Okay, so first, Dr. Raj, are you there?
Yes, Dr. Nusrat.
Okay. Your patient is Mrs. Asma, 32 years old female, came to discuss her problem with you. Please proceed with history, examination, and management plan.
32-year-old Asma,
Yes, Mrs. Asma.
Mrs. Asma. An examination is required?
Yes.
Okay,
Dr.
doctor.
Okay.
Iman, it's case number one.
Case number one. Give me 1 minute, doctor. I had to put a timer for you. Okay, Dr. Raj, start.
Okay. Hello, Miss Asma. Good morning. I'm Dr. Raj. How may I help you?
Doctor, actually, my hands, they feeling so much numb these days.
Okay. Can you please tell me more about it, Miss Asma?
Yeah, at night, it's mostly getting numb, and I'm waking up at night because of this numbness. And even when I'm driving, I have the similar condition, and it's really bothering me.
Okay, Miss Asma, I can understand it's a very difficult time you're going through with this numbness. Before that, I want to ask you a few more questions. Is this okay with you?
Sure, doctor.
Okay. So, as you have mentioned about the numbness, so since how long you have been experiencing this problem?
It's in 6 months now.
6 months now. Okay. So it was started gradually.
Yes, doctor.
Is this first time episode that has been occur?
It's been going on 6 months, but now since last 1 week, it's getting worse.
Okay. So how's been progress up till so far?
It's getting worse and worse daily.
Mm-hmm. I can understand. So, Miss Asma, please tell me that do you have noticed any pain along with this?
Not actually pain, but when it's completely numb, then I feel I cannot do my daily chores.
Okay. So, may I ask you that any history of a fall,
No, doctor.
any history of trauma?
No, doctor.
Okay. So, may I ask you that do you notice any weakness along with this?
No, doctor.
Okay. So, does this numbness started have you taken any heavy object along with this that aggravate the symptoms?
And
Hello.
no, doctor. Only when I'm driving or when I'm cooking, then it's getting worse.
Okay. May I ask you that please show me where exactly do you have this numbness feeling?
Yes, doctor. It's in my both hands, mostly in this first three fingers.
First three fingers. Okay. Do you have any morning stiffness along with this?
No, doctor.
Okay. So may I ask you that do you have any history of high blood pressure,
No, doctor.
high blood sugar?
Yes, doctor. I'm diabetic since last 1 year.
Last
1 year.
1 year. Okay. So what medication are you using so far?
I'm on lifestyle and also metformin 500 milligram BD.
Okay. So have you checked with the follow up with the doctor as well?
Yes, doctor.
Okay. What was your last HB1C?
7.8.
7.8. Okay. Miss Asma has quite been high. So Miss Asma, what was the last menstrual period?
And 3 weeks ago.
3 weeks ago. Okay. Are your menstrual cycle regular?
Yes, doctor.
What's the length of your cycle?
28.
Okay. And how many days you bleed?
7 days a week.
Okay. Is there any menstrual cycle or any clots you notice in between the periods?
No, doctor.
Okay. Are you sexually active?
Yes, doctor.
Okay. So any birth control pills are using so far for any purpose?
Yes, doctor. I'm taking the COCPs
COCPs. For how long you are taking this medication?
since 5 years now.
Since 5 years. Okay. So may I ask you that do you notice any symptoms of pain while having a private relationship?
No, doctor.
Okay. Any bleeding from down below?
No, doctor.
Okay. May I ask you what was the age of a last born child you have?
It's 5 years old.
5 years. 5 years old. Okay. So may I ask you that do you have any family history of a long term illness?
No, doctor. Only just diabetes. My mother had sugars also.
Okay. So may I ask you that do you have any fever recently?
No, doctor.
Any other joint pains?
No, doctor.
Any weight loss?
No, doctor.
Any night sweats?
No, doctor.
Any lumps and bumps?
No, doctor.
Okay. So may I ask you that what do you do for a living?
I'm a housewife.
Housewife. And how's everything at home?
Everything is fine. Just I cannot do my daily work as I used to do.
I can understand. Must be very difficult for you to maintain with this. So I want to ask you that how's everything at home?
Doctor, just I cannot cook the way I used to. My hands get numb, and I cannot take care of my kid. If as soon as I pick him up, it's getting me numbness or more. At night, I'm waking up and shaking my hands. And that's how I get better, but it's really bothering me.
I can understand. Must be a very difficult time for you to have this. So, Miss Asma, do you smoke?
No, doctor.
Do you consume alcohol?
No, doctor.
What about daily exercise?
No, doctor. I don't get time.
And what about typical diet you take?
I'm trying to cook home food, but I'm taking junk since it's paining, getting my hands getting numb. That's why.
Sorry?
My hands getting numb. That's why I'm taking takeaways from
Okay.
outside.
Okay. Okay. So may I ask you that? May I ask you what about your weight according to height?
Ready to.
32. Okay. So Miss Asma, how about your sleep? Is been sleep also disturbed because of this numbness?
Yes, doctor. I'm waking up at night.
I can understand. So Miss Asma, may I ask you that you came here by driving?
Yes, doctor. I drove myself, but I had to
Mhm.
stop in the middle many times.
I can understand. So how far has been impacting your daily life? As you mentioned about this, that is impacting you a lot. How far is that?
Just doctor, I want quick relief medication for it because it's really bothering. That's how what
Mm-hmm.
I'm in.
So,
Yeah,
okay, okay, Ms. Asma, please tell me that what's crossing your mind? What do you have?
maybe a nerve compression.
And any specific worries that bothers you?
Doctor, maybe it's a side effect of this medication. So should I stop it?
I can understand. So, and what do you expect from today's
Sorry.
what do you expect from today's consultation?
Yes, any treatment or any scan if I need any.
Okay, Ms. Asma, let me summarize that discuss so far. You presented with the complaint of numbness in your arms, in your wrist, basically for about 6 months, and that has worsened you a lot. You are diabetic, and you're taking metformin and lifestyle modification, and you just present with that it might be affect because of your medication, and you want some treatment for this. Is that okay?
Yes, doctor.
Okay. Okay. I want to examine you, Miss Asma.
Sure, doctor.
Hello. Okay, I will do the alcohol sanitization and presence of Chevron to be part of my examination. I will check your blood pressure, pulse, respiratory rate, oxygen saturation, and your BMI, which is already mentioned 32. And then I will check your arms, both of your arms for any pain and for any sweating, any muscle wasting. Then I will check in our muscles, is there any wasting or not? And then I will check the carpal, tap your wrist area to check any numb, any uh, any feeling like violin signs and tin sign, both I will examine it. And then I will check sensation also. Is there any finding?
Thinner wasting, sensation of the median nerve
Mm-hmm.
distribution is affected. Uh,
Mm-hmm.
Otherwise, TNLs is positive.
Okay. Okay, Ms. Asma, as per history and examination, it looks like the most probably condition you are going through is called carpal tunnel syndrome. Do you have any idea about it, Ms. Asma?
No, doctor.
Okay, it's a condition, Ms. Asma, that basically your nerve that has been passing through from the bones in the wrist area has been compromised because of multiple factors. It can include because of the diabetes you have and the obesity. You have a BMI of 32. These are both risk factors which are found in your case.
Time up, Dr.
So
Raj.
how about that if I give you some treatment options?
Time up, Dr.
Okay.
Raj. Dr. Raj, you took almost
Okay.
8
Okay.
minutes and 20 seconds while data gathering. Just wanted to ask you two questions, and I'll be giving my input. Dr. Raj, is there any difficulty you were facing that you took patients or gynec history too long? What was the reason behind
Yes,
taking so long history?
yeah,
Any correlation you
Dr.
found
Imran,
in
I
between?
took a
Yeah.
long history because I was confused between two. No, I was
O-
difficulty between two because the patient has
Okay.
complained about difficulty in picking the child, and then the again the complaint of having the numbness and in the arms in both.
Mhm.
So I was having difficulty between the
Mhm.
synovitis and the thing carpal tunnel. But I found it this was carpal tunnel in the end. But it took me a little bit long time because I have to take the gynecological history a lot because I want to find out that is she's pregnant or not and all these. So the two
Okay.
factors I found in this because obesity and the diabetes are the most risk factor of the carpal tunnel and the thyroid
Okay. And
also,
what
but
was
there
the
is no
risk?
thyroid history.
What was the risk factor for this patient?
The diabetes is the risk factor in this case, and the obesity both are the factors in
What
this.
about
Uh,
COCP?
COCP can be the reason. It could lead to the obesity as well. COCP is
Okay.
also reason for this.
Okay, doctor, there are a few things let me tell you,
Mm-hmm.
just as a teaching way. In the history, what we are taking, that is one of the most beautiful thing. They call it data gathering. Okay, data gathering is um, typical thing that which is deciding our outcome for our exam scenario. That till what approach we can reach within 10 minutes. Am I right?
Mm-hmm.
Okay, here there are so many things are there. We have to look into that. First of all, the patient age. Now see this in this one, the patient age was doctor. What was the age of the
32.
patient?
32.
32.
32.
She is just like say about middle, just not too old patient. Okay. Now
Mm-hmm.
she is a female.
Mm-hmm.
Okay. And we have to see few things like say in OSCE perspective, we have to see that total things are there in total scenario. One is a presenting complaint, onset, duration, and pattern, whether it is intermittent or constant. Okay. There is a diurnal variations or night waking up or not. Okay. What is the distribution of the symptoms? If like say, yeah, as you asked the patient, how was the hand? Okay. And precipitating factors while she's getting whether typing, driving, lifting, she having problem with lifting the baby and vibrating tool if in case if there's a patient, patient is a female and working on some sort of textile industry where she is having using some sort of sewing machine or whatever so on, garment factory, and the severity and functional impactment, okay, whether she is getting sleep disturbance or not. How does her works are affecting or not, driving, taking care of children or hobbies. When she is able to drop the object, she is able to hold the object or drop the object. She's getting some sort of fine tuning. Many time agenda will be there. Doctor, I can't hold that fork while eating food. I can't hold my baby. I fear that I might drop the baby. Okay. Now one. Number two, doctor, we have to see the associated symptoms. Whether she's having pain in the neck, shoulder, or arm pain, weakness in the hand or arm. This is the normal scenario we're getting. Past medical history and risk factors are there: CKD, pregnancy, obesity, wrist trauma or arthritis, diabetes, thyroid disease, rheumatoid arthritis, or other inflammatory diseases are there. And sometimes medication. Okay, especially any contributing due to which cause fluid retention. Okay, occupational and social history is important. Ideas, expectation. Examination, you did good, but this examination was incomplete. You know why? From inspection, sensation, and motor. Okay, then you have to go to provocation test. Okay, like say Fallon test, reverse Fallon, or Tinel test. Either one you have to do it. If you are not performing, it will be considered incomplete. Second thing, we have to exclude other cause. So I have to see the range of motion movement of your patient's cervical spine screening, we call it. Okay, movement, tenderness, and radicular symptoms are there. Okay. Okay, so here this examination is a little bit more tricky than look like it is carpal tunnel syndrome. I'm going to examine on that area. No, I am going to see because many candidates get negative in this way because they don't perform the proper examination. Proper examination not only based that I'm going to see the wrist doctor, I have to see cervical motion. Okay, cervical tenderness, cervical movement and radicular symptoms I have to see. We call it cervical screens, cervical spine screening. Okay, to rule out other causes means that say I am going to see, like say how a general physical examination is important while doing while doing abdominal case, GIT case, or while doing some sort of cardiac case, or maybe some renal or nephrology case. So same way it is important to do the cervical spine screening. Okay. So you were unable to complete this the case because you reached up till the investigation. So investigation, what was the investigation required, doctor?
It would be the complete blood count. ESR would be required. TSH would be required in this to check is there any thyroid issue or not.
Okay.
And the wrist joint as well. X-ray.
Blood test, yes, of course. You said that HbA1c, thyroid inflammatory markers are there, and nerve conduction studies. If
Okay.
we are thinking that diagnosis is uncertain, okay, if you're thinking that atypical distribution or features are there while getting examination finding, okay, examiner says a typical feature distribution. You're not getting that whether it's a carpal tunnel syndrome or some other nerve pathology or nerve injury or nerve damage is there, huh? So we have to
Mm-hmm.
say in that way. For example, the scenarios will be straight away. I got it, this carpal tunnel syndrome. I'm 100% sure. But examiner suddenly say, no, doctor, there is some sort of atypical distribution. He's saying, mentioning, okay. In that case, I have to say that I'm going to refer you for nerve conditional studies.
Okay.
Okay, so yeah, this thing you have to remember that here it will not be sometimes straight away. Sometimes it will be some look like very simple case, but it's most typical case in that way because there is a trap which we don't recognize, which we don't remember, which we don't understand when it will happen. Okay, and what will be the management, doctor? Just as you didn't, I was unable to complete. So can you tell me that what will be the management plan?
Uh, about the carpal tunnel management, it could be a night
Yes, doctor.
brace. We have to ask the patient to apply the night brace throughout.
Yeah.
And the second thing is there's the NSAIDs. Topical gels will be the given, and oral NSAID has also be given because to decrease the inflammation of this. And other than that, we have to ask the patient to decrease the weight because the BMI is 32. With the help of this, also improve the symptoms, and diabetes should be controlled. The HbA1c is 7.8 in this case, so it should be also
How many
controlled in this.
how many tablets she was taking?
Metformin she is only taking, and the lifestyle modification she was only.
Yes, then you have to increase the dose. Okay, yes, good.
And second thing, we have to send the patient for the physiotherapy
And
as well, and occupation.
doctor, there will be no NSAIDs. Okay, paracetamol, simple analgesia. Okay,
Why and
but
why
we,
paracetamol, Dr.
but
Imran?
yeah. Let me tell you because there is a nerve compression. No, okay, underlying compression
Mhm.
will not be treated with this kind of simple things. Okay, just we are giving symptomatic relief or partial relief. Okay, patient anyhow going for
Okay.
some sort of entrapment release, either with injection, either with something based on patient case, like say maybe mild to moderate. Yes, you can do this one, but if it is severe, definitely you have to send for this what you call it injection. Okay, if there is
Intralethal steroids.
yeah, if patient having only pain, but if patient having numbness, then we don't give any painkiller. Okay. In case if you're giving the painkiller, it will be considered again. We are not a safe doctor because we don't understand whether this is a pain or something. Because if nerve pathology is there, you should not order any painkiller. If patient having only pain,
Okay.
yes, you can say. But if patient having others are like say numbness, as she in this case she's having, so you should not say doctor this one. Okay. So you know why? Because here this is a trap. This is a trap where we see that we think that okay,
Okay.
no, I'm going to release the inflammation, anti-inflammatory I'm giving, so it will help her to release that entrapment. No, doctor, it might not, because this is ligamental and entrapment of the nerve is there. Okay, so here we can say that I will be referring you
Okay.
for I'm giving you corticosteroid injection. This was the examination. This was done in our OSCE orientation program in Abu Dhabi, and they given this one. Okay, so they say that we are going to consider for corticosteroid, and we ask him. Okay, we asked doctor how are we going because I'm working in UAE. Okay, here UAE we are going to refer this patient anyhow for the orthopedic. This is a protocol. Because but he says in the South Asia, why are you going to send this patient to orthopedic? You're going to give this injection to that in the joint in that area. Okay, so we are going to consider for the corticosteroid injection if patient having moderate carpal tunnel syndrome, not responding adequately to the splint. For example, scenario comes. Doctor, I'm being treated with the carpal tunnel syndrome since many days, but this splint doesn't work. Can you tell me something different? Okay, what then we have to set for the card? We have to mention for corticosteroid injection, and patient desire quick relief. If patient says, "Doctor, I want quick relief," and fully inform, and we have to inform that benefits and circumstances and recurrence rates. We have to tell the patient. Okay, and usually we have to say that it will be performed as a single local corticosteroid injection into the carpal tunnel. We have to follow local guidelines. Again, why I'm telling about local guidelines, because in the UAE we are not eligible to do this thing, but in South Asia, yes. You understand what I mean? So in GP practice in
Okay.
South Asia, it is
Okay.
recommended to give the corticosteroid injection in carpal tunnel. Carpal tunnel. Okay. Okay. So and we have to
Okay.
explain the patient. Okay. Yes, exactly. This is what examiner want to listen from
So
you, doctor.
means Dr. Imran, NSAID should be given.
NSAID will not be giving. Only we
Okay.
will be
So I
giving
want to clarify
paracetamol.
again. So no NSAID should be given until
Yeah.
the painful
If patient having only pain,
paracetamol.
but patient
Okay.
this patient
And
having
second
numbness,
thing, we have
doctor,
to
we are
only
not.
provide the night brace. That's it.
Yes, doctor. Yes, doctor. And yes, and we have to offer for this one. Okay.
Okay. Okay.
So
Thank you.
and for indication for the referral. Okay, surgical referral in
Okay.
MRCGP South Asia
Okay.
protocol. Refer to the orthopedics or hand surgery if you're think about you patient having thinner muscle wasting and objective weakness of the thumb while doing abduction or opposition. Okay. Persistent or severe symptom despite adequate trial of conservative therapy. For example, after 3 month patient come for a sprint usage, okay, and coming for that one. Ah, doctor, yeah, last time that other doctor giving me this injection, doctor, it's not working. Yes, this is for surgery now. Here it is not for against injection. Okay, and patient symptoms significantly impair function and quality of life. Doctor, I am a typewriter. I can't do it. This thing, it's my, I will lose my job. So here you have to refer for the surgery. Patient having, patient can't do it. Here, if I'm giving injection, it might not help. It will take time. Patient will lose the job. Okay, and diagnostic uncertainty. For example, if I am having, I have seen that red flags are there, but I'm uncertain about the condition. I have to send, I'm going to refer you. You are the safe doctor. Okay. What
Okay.
surgery will do that you should tell the patient. They will do small, some simple procedure. Okay, with a camera to remove the carpet. You should not say that they will cut your arm. Okay. Because if you say cut your arm, patient will take you to other world. Okay, so here you have to say
Mhm.
they will put the small, they will make small hole with the camera and they will release this ligament. They will release this tension. Okay, as always,
Okay.
I am saying to you guys, for safety netting, don't waste too much time. You always say that if you are running short of time, please say that if your symptom worsen, please come back to us. That's it. If you say this thing, your safety netting throw and throw cover, doctor, because you already gone through red flag. Okay, yes. So, doctor,
Okay.
what is the next case?
Okay, case number just case
Which
number
doctor?
four,
Case number four. Okay.
fourth. Yes, and a few points I want to add. Like whenever the patient is coming with the numbness or anything, just ask which like side, where is it, which hand, right or left, and also ask for the dominancy of the hand. Every time you're
Yeah,
getting any hand
yeah,
problems or dominant hand. And
yeah.
uh, yes, doctor.
No, 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 continue, continue.
And you were asking about the weight loss. Instead, in this kind of scenario, we should know changes in weight. Okay, because weight loss is for the cancer pathway. Here, we cannot expect any cancer or something like that. And repetition of
Hmm.
questions were many in history taking. That's why it was longer history. Okay, otherwise fine. Doctor, okay, let's start.
Dr. Raj, next case for you.
Yes. Yes.
Your patient is Mr. Ahmad, 64-year-old male, came to discuss his problem with you. Please proceed with history, examination, and management plan. Examination is grave.
Can I,
Okay,
okay, can I
start.
start?
Yes, start, doctor.
Hello, Mr. Ahmed. Good morning. I'm Dr. Raj. How may I help you?
Yes, doctor. Actually, doctor, I'm very worried.
Hello.
Yeah, doctor, are
Can you
you?
hear me?
Yeah, doctor, are you hearing?
Okay. Hello.
Yeah,
Hello.
Dr. Raj, yeah,
Are you able to
are you
hear me?
audible? Yeah, 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 we are hearing you.
Yes, yes, yes,
Yeah,
yes, yes.
doctor.
Now audible.
Yeah.
Okay.
Okay, start.
So, can you please again say, Ms. Nusrat?
Yeah, yeah, yeah.
Okay. Actually, Mr. Ahmed, and I'm very worried about my health, doctor.
Okay. Can you please tell me more about it, Mr. Ahmed?
Yes, actually, since last I got heart attack 6 weeks ago. I feel low all the time, doctor. And I'm really scared that I will get another heart attack.
I can understand, Mr. Ahmed. It must be a very difficult time you've gone through. But I want to ask you a few more questions related to health. Is that okay with you?
Sure, doctor.
Okay. Mr. Ahmed, please tell me that when was your heart attack was diagnosed?
6 weeks ago, I was admitted.
Okay. May I ask you what procedure was done in the hospital?
And they gave me some medications, and I was relieved. And um, they gave me discharge and few medications
Okay. So you were stayed in the ward or stayed in the ICU?
in the ward.
In the ward. And what procedure they have done?
Doctor, they say PCI. I don't remember what procedure, but I was just diagnosed with this.
So are you compliant with the medication?
Doctor, I'm taking on and off, but I'm really feeling low.
I can understand. So may I ask you what medication they have prescribed you?
Aspirin, beta blockers, ACE inhibitors, statins, and clopidogrel.
And sorry,
Clopidogrel.
clopidogrel. Okay. So are you following with the doctor as well?
Yes, doctor.
Have you joined any rehabilitation program?
Yes, they told me to join, but I'm not going because I don't think so. I am going to stay alive. I feel like I'll get another heart attack.
May I ask you what happened exactly when you have a heart attack? What were you doing that time?
Doctor, actually, my business collapsed and I couldn't
Mm-hmm.
take the stress. And then my chest started having pain. That's how I went to
Mhm.
the emergency.
Okay. Mr. Ahmed, I want to ask you, do you have any chest pain right now afterwards that?
No doctor.
Any short of
No
breath?
doctor.
Do
No
you feel any
doctor.
dizzy?
No doctor.
Any headache?
No doctor.
Any swelling in your legs?
No doctor.
Any pain while walking in the legs you have?
No doctor.
Any blurred vision?
Hello?
Hello. Any blurred vision you have noticed so far?
No, no doctor.
May I ask you some sensitive question if you don't mind?
Sure doctor.
Do you have any difficulty in maintaining erections while having relationship?
No doctor. My wife died 2 years ago.
Oh, I'm sorry about your loss. Mr. Ahmed, so how about that? You have returned to your work?
Hello?
Have you returned to your work?
No doctor.
Okay. So as you mentioned that you have a very low mood for the past few days. So I want to ask you, do you have lost any interest in favorite activities that you were doing before?
Yes doctor, I just don't find any happiness. I feel like I lost purpose
Um,
of my life.
I can understand, Mr. Ahmed. It must be difficult for you, very. So do you have any loss in concentration of memory as well?
I have a good memory, but doctor, I don't want to concentrate on anything. I just stay in bed all the day. Don't want to do anything.
Mhm. Have you ever thought about any harm to yourself or any plans to made?
No doctor.
Okay. So any past medical history of other than you have a heart attack, other than this, you have any history?
Yes doctor, when my wife died, I also had depression that time. They put me on medication and some talk therapy. I was better, but now
So
I
what
feel
medication you were
low
taking for
again.
sorry, so what medication you were taking for depression?
I took sertraline, but they gave
Mm-hmm.
me for an air, then stopped it.
Then stopped it. Okay. So may I ask you that do you have any drug allergy?
No doctor.
Any family history of a long term illness?
No doctor.
Okay. And whom do you live now with?
I'm living alone.
Living alone. And what about the daily activities? Are you managing with easily?
Just doctor, I'm locked in the house. I'm not going anywhere. Yes, my daughter accompany me. She is staying with me these days.
Mm-hmm. I can understand, Mr. Ahmed. So, Mr. Ahmed, I want to ask you that do you smoke?
Yes, doctor, I quit smoking, but now because of my stress, I'm taking cigarettes again.
You're taking cigarettes again. So, how many cigarettes per day?
Just one or two.
One or two. So, Mr. Ahmed, do you have a thought about quitting the smoking?
Doctor, I don't know. I will get another heart attack. I don't think so. I shouldn't quit anything. My life will
Mr.
end
Ahmed,
like this.
it has very hazardous effect on your health. I will give you a second session. How about that if I ask you to have a second thought about it? Are you okay with
Sure,
this?
doctor. Okay,
Okay. And
doctor.
what about alcohol consumption?
No, doctor, I don't.
Are you able to do exercise easily?
No, doctor, these days I'm not doing anything.
And what about typical diet you're taking?
I'm taking my home cooked food, whatever my daughter cooks for her.
And what about sleep?
It's disturbed. I'm just waking up at night thinking I'll die while sleeping.
hmm And may I ask you that what about your driving? Do you drive?
No, doctor.
Hello?
No, doctor, I don't drive.
Okay. So how far has it been impacting your daily life? As you mentioned about that you have facing very low mood for these.
Doctor, I'm not doing anything. Even my daughter is just struggling with me. She's tearful because of my condition, and I'm not taking medication on time. And I'm bothering myself and her also. I don't know what to do.
Okay. And what specific worries that bothers you?
I'm getting another heart attack.
Okay. And what do you expect from today's consultation?
Just tell me what to do, doctor. I'm just so much worried.
Okay, Mr. Ahmed, as per your history, what have you mentioned it looked like the most probably condition you've gone through is called post myocardial infarction, depression. Do you have any idea about it?
Yes, doctor, it's a kind of depression.
Yes, Mr. Ahmed, I can understand you have gone very toughest time of your life while facing this heart attack, and because of this, you are facing a very low mood for this. I hope you understand this.
Yes, doctor.
So, how about that if I ask you that, see, all the patients who face this kind of a problem has up and down in their life. So it can be managed as the time passes by. Okay, you can return to your work, you can return to your life as per usual you were doing it, but take a little bit time. You have to not lose your hope. Okay, Mr. Ahmed, are you getting me?
Yes, doctor.
As far as your medicines are concerned, and you're thinking that you are keep on forgetting your medicine, but it can be possible that you can keep an alarm on your mobile gadgets, or you can have ask your daughter to keep on reminding you take these medications, because these medications are very quite essential for your life. If you not take this medication, it might lead to have another heart attack. You are right about this. Are you getting me?
Yes, yes, doctor.
Yes. Okay. So, Mr. Ahmed, I will request you to take a healthy diet and keep yourself away from smoking, because smoking has been the contributing factor for the heart attack again. Okay.
Okay, doctor.
And while your depression is concerned, I will request you to have arrange a meeting with with a specialized person who is thinking about cognitive behavioral therapy. There's a knowledgeable person sitting in front of you. He will definitely take out the negative thoughts from you and put the positive thought. I hope that you have already taken this previously as well. You remember this thing, and you have taken the sertraline as well. So you have to start this medication again to lower down your symptoms. I hope you understand this.
Yes, doctor.
Okay, so as you have not started your work up till now, so I will request you that you can start your work, but you can start at least light work after 2 months of your time, and you can gradually increase by 3 months. Okay. Meanwhile, I will ask you to have regular exercise, keep yourself fit and fine. It will not strengthen your muscles as well, but keep your heart fit as well. It will circulate all your muscles and keep yourself fit. How about that?
I try, doctor.
Mhm. Mr. Ahmed, I will request you to have a vaccinations of your for pneumococcal vaccine and the influenza vaccine. These are the both vaccine very quite essential for your life. Keep your mortality benefits as well.
Time
I
up,
hope you understand this.
Time up, Dr. Raj. Dr. Raj, wonderful attempt. But whenever we are getting any patient, any case with consultation and management only, so we have to divide the time into 5 into 5. Okay, five
Mhm.
into five means like say there are a lot of queries are there by the patient, and especially in idea and eyes and concerns and impact. Okay, so there are many things are there. So specifically, we have to talk about eyes that he is thinking about some sort of normal reaction or maybe depression. So we have to explain what it is. Second, concern. He is thinking that he will not be normal again because he gone through the trauma. He is expecting that some support from us, medication and counseling. So you address this thing. So how about impact, doctor? What do you say about impact?
The impact concern was, I think she was asking about medications. She's not person is not taking medication on time. Keep on forgetting it. So I've addressed that also. Can keep an alarm on the mobile, so you have to take a medication on time, or you can ask the family members, including your daughter. She can remind him to take the medication on time. I think this was a impact she have.
And what about PHQ-9? It was applicable or no?
The patient only have a low mood and loss of interest. I have not asked
Mhm.
many questions because the time was very short for this.
Mhm.
I have to ask many
Yeah.
things.
Yes. Okay. This case is mostly based on something. Either patient will come with low mood, lack of sleep,
Hmm.
lack of interest in working, loss of energy, and fatigue, tired, loss of appetite, weight changes will be there. He can't concentrate at work, for example, if it is he's on the work. He is feeling guilt as he was getting. Okay, and psychomotor changes will be there. He will not be talking, agitated, mood swings will be there, ideation for the suicide. So many things. Here, if you are asking only two or three, it will be fine. We should not go through whole checklist. Okay, last 2 weeks. We
Uh,
have to ask about last 2 weeks. So why? But
mhm.
because we call it PHQ-9 mental checklist,
Dr.
depressive
Imran, I have
symptom.
already, I think I have asked four questions about this.
Yes,
I
doctor. Yeah,
think
yeah.
low
You
mood
did,
for
you
past
did,
two
you did.
weeks, lost interest, and okay.
Yeah. So this is what we call it PHQ-9, no? Domain.
Mm-hmm. Mm-hmm.
Okay, and then what about cardiac and physical context? You ask about time and MI, type of MI, type, and what was the procedure done. So gone through cardiac rehabilitation program or not, registered or not, what medication he or she is taking. Here we have to explain the medication, what medication is doing, for what medications are.
Mm-hmm.
Okay, yes.
Okay.
And the psychosocial factors are there. Mostly the patient will be having some family issues, maybe work-related issues, from financial pressure, because he's a bread butter earning person, he's a laborer. So maybe he's not going to the work, so his concern will be there. So you address that one. Screening tool, you can use it. Many people are using PHQ-9, many using GAT-7. So it up to you
Mm-hmm.
guys, doctor. You can use it because both are international screening tools are there, so we can use it. There's no restriction that I have to use PHQ-9 or GAT-7. For
Okay.
examination, if that is not required, so we have to talk more about patients, condition, education, validation, lifestyle, self-management, lifestyle and self-management, and psychological therapies. Okay, so sertraline. How and then when you are saying Dr. Sertraline, so still you have to say that Mr. Khan, that's he maybe stopped because it's not working. Okay, you have to tell that this has been just started 10 days ago. It takes at least 2 weeks to work properly.
2 to 4 weeks. Yes.
Yeah, 2 to 4 weeks. So patient might stop because he will say that doctor given me this medication for relaxation, but it's not working. So it means
Mm-hmm.
I have to explain about mode of action, duration of action, and side effects, suicidal thoughts, suicidal
Yes. 2 weeks
ideation.
suicidal thoughts.
Yes,
Yeah. Yeah.
that
Yeah.
that is also agenda. Plus,
I missed it.
yes, okay, yeah, that is important, very important part here in
Mm-hmm.
this kind of cases. And risk assessment, and you have to see. And yes, you can add on here in if is it okay, Mr. Khan, that if like say we are calling your wife next time with you while consultation?
My wife is not
Yeah,
there. She passed away.
Dr. Iman, yeah, in this case, the wife was
Doctor,
died,
we can call
was died.
next time.
Next time
It's
I will call
possible.
next.
Uh,
We will call. Shall
uh,
we call? So here you should not say I'm going to call. I will call next time. No. And here we have to say that is it okay that we will engage your family member like your wife or anyone else? So you will say you can call my son or you can call my wife.
the
You can call my brother.
daughter is taking care,
Mm-hmm.
yes.
Yes, daughter. So we have to talk about something which is more related to patients, social support.
Mm-hmm.
Okay, and family support. Otherwise, from my side, it was correct. Doctor, from your side, anything?
Just one or two points, like his concern was getting another MI, and he was not taking medication intentionally. He wasn't forgetting it. He was like, I don't want to take, maybe I'll get another heart attack. So here we have to explain these medication are for the prevention of another heart attack. We have to explain it very clearly because these are the secondary prevention medications. So if you keep on taking this medication with cardiac rehabilitation and they keep on getting the follow-up, I assure you won't get another heart attack. And he was staying in bed all the time. Tell him it's not good for you. Try to have a normal walk or just don't stay all the time in bed. And try to give him a sleep hygiene routine also if you get time. And yeah, he lost his work. Actually, his business collapsed. So he
Mm-hmm.
wasn't doing anything at the moment. So here we cannot ask like did you go to your work again or join your work after this time? Because he wasn't having any job at all. So only this point. Otherwise, it was fine. Okay. Next case.
Yes, doctor. Case number, doctor.
Okay. Case number 8.
Mhm. Okay, doctor.
Hello.
Yes, doctor. Start.
Hello.
Okay, start.
Okay, give that description.
Oh, I'm sorry. A 35-year-old female, Mrs. Aisha, came to discuss her problem with you. Please proceed with history, examination, and management plan.
Okay. Shall I start?
Yes.
Yes, doctor.
Hello,
Start.
Mr. Hello, Mr. Asha. Good morning. I'm Dr. Raj. How may I help you?
And doctor, actually, I'm putting on so much weight these days,
Can
and
you please tell me more about it?
I don't. Yeah, actually, doctor, I was recently diagnosed with this a gland problem, and they put me on medications. I am taking it daily, but I don't know if it's controlled because I have this weight a lot.
Mm-hmm. Okay, Ms. Asha, I want to ask you a few more questions related to health. Is that okay with you?
Sure, doctor.
Okay, Ms. Aisha, as you have mentioned about this issues, so since how long have you been experiencing this problem?
Doctor, this was going on for last 7 to 8 months. Then I visited a GP, and he told me that I have gland problem, and now I'm on thyroxine tablets daily.
You're on thyroxine tablet daily. Okay. So, Ms. Aisha, please tell me that do you feel any heart racing?
No, doctor.
Okay. Do you feel any change in your weight?
Yes, doctor, it's keep on increasing.
Okay. And may I ask you that do you feel any fatigue?
Yes, doctor, I'm tired all the time.
Any change in bowel habits?
I'm mostly constipated, but the doctor told me these medications will help me out.
hmm Okay. Any swelling in the legs?
No, doctor.
Any changes in your vision?
No, doctor.
Any notice any dry skin you have?
Yes, doctor, I used to have, I'm putting moisturizer a lot.
hmm Do you have noticed any deepening of your voice?
No, doctor.
Okay. May I know that you have lost your hairs on your body? Do you have noticed that?
Yes, doctor, my eyebrows from the sides are getting thinner.
I can understand. So, anybody told you that you snore in the night
No, doctor.
while sleeping? Have you have a unrefreshed sleep?
No, doctor.
Okay. So, what was your last menstrual period, Miss Aisha?
2 weeks ago. No, in fact, 10 weeks ago.
10 weeks ago. Okay. Are these
Yeah.
regular periods?
Yes, doctor.
Okay. So, do you notice any bleeding in between the periods?
No, doctor.
What was the length of your cycle?
It was regular 28/7,
And how many days you bleed?
7 days.
And are these heavy periods?
It used to be, yes, doctor.
Okay. So may I ask you that are you using any contraceptive methods for any purpose?
No, doctor, I'm expecting a baby and currently I'm 10 weeks pregnant.
How many weeks pregnant? Sorry,
10 weeks.
10 weeks pregnant. Okay. So are you following with the doctor
Yes, doctor.
and medication and the doctor has prescribed you? Are you taking that?
They put me on folic acid only.
Okay. So are you compliant with that?
Yes, doctor.
Okay. So, Ms. Aisha, I want to ask you that do you have any past medical history of a long-term illness?
Uh, Not actually, doctor, but I have this heartburn off and on, so I'm taking over-the-counter antacids.
Antacids. Okay. So, any family history of a long-term illness?
My mother had this gland problem.
Mother has? Sorry, the
This
voice is not.
gland
Gland
problem.
disease. Okay. 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 So, Miss Aisha, I want to ask you that do you have any chest pain along with this?
No, doctor.
Any short of breath?
No, doctor.
Any changes in memory of concentration of your memory has been affected?
No, doctor.
Do you feel any low mood for past 2 weeks?
No, doctor.
And loss of interest in favorite activities that you're doing before?
No, doctor.
Okay. And what medication you're using other than levothyroxine and folic acid?
Antacids.
Antacids you are using. Okay. So I want to ask you, do you have any drug allergy?
No, doctor.
Dr. Raj, 5 minutes
Okay.
completed for the history.
Okay. So how far has been impacting your daily life?
Doctor, just I want to know why I'm not improving. Like my energy is getting low. Even though I was fine before 10 weeks, and after my pregnancy, I got more weight.
Mm-hmm. And what's crossing your mind? What do you have?
This disease isn't controlled.
Mm-hmm. And what do you expect from today's consultation?
I just want any dose adjustment.
The adjustment. Okay. So, Miss Aisha, let me summarize that discuss so far. You present with a history of 7 to 8 months of having this gland disease, and you're taking the levothyroxine, and you are 10 weeks pregnant, and you're worried about that anything that could help you for dose adjustment, and it is not being controlled. Is that okay?
Yes, doctor.
Okay. So, Miss Aisha, I want to examine you. Is that okay with you?
Sure, doctor. Yes, doctor.
Okay, after the alcohol sanitization and the chevron to be part of my examination, I will check your blood pressure, pulse, respiratory rate, oxygen saturation, and your BMI, which is weight according to height. Then I will check your arms for any sweating, any clubbing, any anemia, and then I will check your eyes as well for anemia, and then oral cavity also. Then I will check the lymph nodes from the back, and I will ask to take a sip of water so I can see it. Then I will check the from back as well while having you to take a sip of water as well, and then I will palpate, and then I will tap the chest as well for any retrosternal goiter as well, and then I will listen the sounds for any bruit. Then I will check the heart sounds as well and check the lower limb as well. After that, I will ask you to please come on the couch as well so I can see the fetal height as well. Is that okay? Any
Okay,
positive
doctor.
finding?
Pulse is 62, and the thyroid exam show according to the hypothyroid.
Hypothyroid feelings. Okay.
Yes.
So, Mr. Aisha, I want to do some investigation for you. Is that okay with you?
Sure, doctor.
Okay. I want to do complete blood count, thyroid profile, including TSH and 3334, ultrasound thyroid, anti-TPO antibodies as well, and ESR and CRP, and also the fetal ultrasound as well.
TSH is elevated, and
Mm-hmm.
T4 is low. Otherwise, pending.
Okay, Ms. Aisha, as per history and examination, it looked like the most common condition you're going through is called hypothyroidism, which you have already been diagnosed before, and you're taking the levothyroxine instead. Is this okay? So, how about that? If I ask you to take this medication on the regular basis, is that okay with you? You can take this medications.
Yes, doctor. I'm taking regularly.
Okay, and what the strength of the medication you are taking? 50.
Yes, doctor. 50.
So we have to increase the dose of this medication to 75 mg. By far, I will refer you to the specialist as
Mm,
well. So
okay.
the specialist is going to evaluate you for the symptoms you are having facing, and might be going to adjust afterwards. Okay, is that okay with you?
Okay. Sure, doctor.
Okay. Meanwhile, as you are noticing these that you want a dose adjustment for this, so this can be only reviewed by the specialist. Meanwhile, you take some lifestyle modifications. Are you able to do that?
Sure, doctor.
As far as the symptoms are considered with the hypothyroid, so uh, the things is considered to be that should take regular exercise, have a healthy diet, and should avoid take a junk food. Are you able to do that with this?
Sure, doctor. Yes.
Mhm. If you notice any worsening of symptoms despite of taking this medication, so you can return back to me to the ER or come directly to me. I'll provide you my number, so you can contact me as well. Is that okay?
Okay, doctor.
So, do you want to ask any question from me?
No, doctor.
Okay. Thank you so much.
Thank
Okay, Dr. Raj, still 30 seconds are remaining. What do you want to say anything?
Doctor, I'm totally confused right now. So forget
Why?
everything.
What? Okay, tell me what's the reason. No
Uh,
problem, doctor. Just we are here to help you. Don't worry.
no, I'm just confused between that the patient is the pregnant right now,
Hmm.
and
Hmm.
she has been difficulty because she's taking the levothyroxine 50 milligram already, and she's thinking that
Uh,
the hypothyroid symptoms are not being controlled. So we have to only increase the dose just to tackle this. Might be
okay.
she having the fatigueness and all that. So we have
Okay.
to think about that
Hmm.
as well
And what
and
other
refer the
medicine she is
specialist.
on?
She's on folic acid only
And what else?
and GERD symptoms and antacids.
And have you asked that medicine how she's taking other medication? She's taking
No, I
together, or
forgot. No, I
that was the
really
agenda?
forgot about this.
That was the
Yes,
agenda of the case. Totally, this
mm-hmm,
agenda. There's nothing such thing, doctor. This was a butter
mm-hmm,
case. Okay, here from here, here, and in this butter only the hair was patient was taking antacid and thyroxine tablet together. Okay,
yes,
and
that's the main
folic acid
problem.
together. All, yeah, that's the main problem. Okay, and
Mm-hmm,
how she was taking? She was not taking empty stomach. She was taking after food.
mm-hmm. I can
Okay,
understand.
so agenda of compliance and to how she's to need to take the medication. Okay, so we have to explain she have to take it at least 4 hours apart.
Mm-hmm,
Otherwise, this case was nothing, doctor. This was a very simple case, and you have to ask if, like, say, in this case, if patient is saying that I'm going to see about this report, okay, and when she did report, maybe it's last month or now, so you should not repeat the test. Okay, so agenda says that you have to follow the same test, but here something lies over here that there is a some either patient is taking wrong dose of medication, either patient is taking some sort of wrong timing medication, or some other
okay.
drug interactions are there.
Mm-hmm.
Okay, doctor.
Okay,
So very
okay.
yeah, don't worry. It is happening. It's normal. Okay, just we have to see that when patient is taking multiple medications, so we have to say how do you take.
Mm-hmm.
Okay, this is also coming
Okay.
in compliance now that whether she's compliant on the time and dosage weight based or no. If she's
Mm-hmm.
compliant on that one, that of course it means she's taking wrong important. But now we have to see that the dose, timing, and adherence, how she's taking, whether she's missing the dose or not. Okay, or is there any concomitant what you call it concomitant
contributing.
medication? Okay.
Yeah.
Okay.
And she's taking some antacid and calcium supplement, for example, iron, PPIs, multivitamins containing iron and calcium. Okay, so we have to ask specially. Okay, and especially you have to ask again, when do you take this thyroid medication in relation to other antacids and other tablets? Okay,
Mm-hmm.
that is the most important part over here.
Okay.
Okay, doctor, this is simple thing from me. Anything you want to add, doctor?
Yeah, firstly, when the patient is saying I'm taking tablets, in the first line in history of presenting complaint, they're telling you I'm taking tablets. Ask which tablets, any other medications, and how many tablets of thyroxine. From there, you will get the case. And yes, it was good that you ruled out depression and the other because hypothyroid and depression go side by side. And if this case, again, if she's not pregnant and if this same case is coming near 50s, so we have to have another DD of menopausal symptoms because patient will be coming with fatigue and tiredness and then depression symptoms and also hot flushes. So one question of hot flushes and some gynae history needs to be asked in menopausal symptoms. Okay. Otherwise, it was fine.
Okay, thank you so much, Dr. Musar, Dr. Imran.
Thank you.
Who is next, doctor?
Dr. Pareen.
Okay. Dr. Farheen, are you ready?
Yes, doctor.
Okay, case number second.
Okay, okay.
Okay, so patient is 21-year-old female. Um, Mrs. Lena came to discuss her problem with you. Please proceed with history, management plan, examination is due.
Case number two, doctor.
Yes,
Okay, can we start?
case number two.
Okay, doctor. Case not examination not gray. Case number two, examination is required.
Mm.
Okay,
Examination is required?
Yes, doctor.
yes.
Okay, can I start?
Yes, doctor. Start.
Good morning, Mrs. Lina. I'm Dr. Farheen. How can I help you today?
Doctor, I get this terrible heel pain whenever I'm waking up in the morning.
Sorry, terrible?
Heel pain whenever I'm waking up in the morning.
Okay, Mrs. Lina, can you tell me more about it?
Yes, doctor, as soon as I get up and I put my feet on the ground, I just cannot walk few steps. And then it eases a bit once when I'm walking.
Okay, Miss Lina, I just want to ask few more questions. Is that okay?
So, doctor,
Okay. Okay, so Miss Lina, tell me since how many days you are facing this problem?
been 3 weeks now, doctor, daily almost.
Okay, you are having this pain daily, right?
Hmm.
Okay. Okay, so Miss Lina, can you just tell me, is this pain started all of the suddenly or gradually?
It was gradually.
Okay. And can you just point out where exactly the pain is?
Doctor, exactly under my heel and sometimes on the medial side,
Mm-hmm. And is it in both of your feet or in the single foot?
both of my feet.
Both of your feet. Okay. Okay. So, Miss Lina, tell me about what type of pain is it? Like, is it the pressing type of the pain or burning type of pain?
It's doctor a sharp kind of pain, but
Sharp type.
as soon as I walk, I get better.
Right. Okay. So, Miss Lina, if I'm asking on the pain scale from 0 to 10, 10 is the most severe and 0 is least severe. So, how you can score it?
7 to 8 of it.
7 to 8. So, are you still feeling pain?
No, doctor, I'm better now, but in the morning, it's really killing me.
Okay. Okay. So, Miss Lina, is this pain go anywhere else in your body?
No, doctor.
Okay. And you told me that this pain relief when you when you walk, right? Is there anything else that give you relief?
No, doctor, nothing else, only when I'm walking.
Okay. And this pain aggravate on the early morning. Is there anything else that aggravate?
Long standing.
Longer standing. Okay. So, Miss Lina, did you take any medicine for it?
Doctor, I was taking this paracetamol tablet, but it's not affecting.
Mm-hmm. Okay. So, Miss Lina, just tell me, do you have any type of numbness in your limbs?
No, doctor.
Mm-hmm. Any type of do you have any history of fall?
No, doctor.
Any history of trauma?
No, doctor.
Okay. And Miss Lina, do you have any long-standing illness?
Doctor, I'm just getting a bit obese these days.
Mm-hmm. And any history of high blood pressure or high blood sugars?
No, doctor.
Okay. So, Miss Lina, is any member of your family affected with similar illness?
No, doctor.
Okay. So, Miss Lina, tell me, are you taking any drugs on regular basis?
No, doctor. Only this
Okay.
paracetamol.
Okay. So, is this paracetamol gives you relief?
A little bit.
A little bit. Okay. So, Miss Lena, just tell me, what do you do for a living?
Doctor, I work as a teacher.
Mm-hmm. And is this thing affect your work? Like, I know that teaching is a difficult job. So is this thing affect your work?
Yes, doctor, a lot, and I've been standing long hours for the lectures, and I cannot really mm, bear the
Right.
pain sometimes.
I can understand, Miss Lena, that how difficult must be it for you. Miss Lena, do you have any other joint pains?
No, doctor.
Any joint stiffness?
No, doctor.
Okay. Okay. So, Miss Lena, tell me, do you smoke?
No, doctor.
Do you take alcohol?
No, doctor.
Any other recreational drugs?
No, doctor.
Okay. So, Miss Lena, tell me, you told me that you are having weight gain nowadays. So, do you have any idea about what's your last BMI?
28.
28. And have you ever tried to lose your weight, like go for a walk or anything else?
Doctor, I was going for just gym exercises, but because of this pain, I'm getting annoyed and I'm not going anywhere.
Right, right. I can understand, Miss Lena. Don't worry about that. I will tell each and everything in detail. Miss Lena,
Five
are you
minute
married?
completed.
Okay. Are you married?
Yes, doctor. I'm in a
Okay.
relationship.
Okay. So I just want to ask a private question. Are you sexually active?
Yes, doctor.
Okay. So Miss Lena, is there any uh, okay, so tell me, what do you think? What's crossing your mind?
Doctor, maybe it's kind of a ligament or a heel injury. I don't know.
Mm-hmm. Anything that you that worries you most?
Yes, will I be able to work or will it make me handicapped?
Mm-hmm. Okay. And Miss Lena, how far this thing impacts your life?
Okay, I just cannot do anything. Like I'm taking sick leaves also because of this from work.
Mm, right, I can understand, Miss Lena. And how far this like what do you expect from me?
Just any splints or any medication that can relieve it.
Okay, okay. So, Miss Lena, after I just want to quickly summarize it. You told me that you are having this pain on the heel is when you wake up early in the morning, and this pain relief when you walk, and you think that maybe it's due to some injury, and you will be handicapped. Is there anything else that you want to add?
No, doctor.
Okay, so Miss Lena, I just want to quickly examine you. Is that okay?
Sure, doctor.
Okay, so in the presence of the chaperone and after sanitizing my hand, I will do the start my examination, checking vitals first, do general physical examination, checking anemia, jaundice, and I will do the detailed examination of both of the foot. And first on the inspection, checking any type of the redness, any sign of the inflammation, and any swelling. And I will check. Then I will palpate, check the temperature of the both of the foot, and I will move the joints. If the patient is not in pain, I will ask the patient, and then I will also check the pulses. Ask the patient if he can move or not, walk or not.
Okay. Um, Tenderness on the medial side and on the plantar side of the foot.
Okay, okay. So Miss Lena, after taking after doing examination, after taking history, I'm suspecting that you have a condition which is called plantar fasciitis. Do you have any idea about this?
No, doctor.
Basically, it is a condition in which it is a condition in which it is due to the pain in the tendon, and the most commonly the pain occurs in the early morning and when you wake up, and it will get relief when you walk. Okay, are you getting my point?
Okay, okay,
Most
doctor.
commonly the
Yes.
reason behind this is due to the prolonged standing and obesity, which in your case that your BMI is on the higher side, and according as your profession is teaching, and you told me that you are standing on for a long period of the time, so maybe the reason behind this is due to this. Is that okay?
Okay, doctor.
So what we have to do, we there are two type of management. First is the medical management. Other one is the lifestyle modification. So which one would you like to hear first?
Anything, doctor, that will benefit me.
Okay, so let's do the non-pharma first, which is lifestyle modification. First, what you have to do, just try to lose your weight, go for the exercise, take some time out, just take 30 minutes and do whatever you can easily do, like go for the swimming and do for the walking and cycling, whatever is suitable for you. Is that okay?
Yes, doctor.
Moreover, you can do ice packing and you can elevate your foot and try not to, stand for a long period of the time. How about that?
Yes, doctor, I'll try.
Okay, and avoid barefoot walking. Moreover, I am giving you some drugs for the for your pain. I'm giving you tablet brufen 400 milligram. You have to take it 3 times a day. Okay, if you have do you have any history of heart burning?
Okay, doctor.
Do you have any history of heart burning? Hello,
Hello?
do you have
No,
any
no, no,
history of
doctor,
heart?
no heartburn.
Okay, okay. So you can take this drug, and I am giving you topical NSAID, which is topical fibrogen gel. You can also apply this. Okay, and if this I will also tell you about some of the exercises. You can I will send you for the physiotherapist. He will tell you some of the exercises that will improve your symptoms. How about that?
Okay, doctor.
If
That's
in case you
nice.
are having severe symptoms that you is not controlled, then you have to come back to immediately.
All right, doctor.
Okay, time up, Dr. Farid. Time up.
Yes.
So, Dr. Farid, have you asked about footwear?
Oh no, sorry, I forgot.
Okay.
Oh,
Uh, there are few things are there which triggering factors and timing. You asked about Socrates, that was good. Onset, red flags you touched, past medical history, but when patient having involvement, so we have to ask about having one or both. Okay, which one is affected more? Okay, second thing, uh, what kind of footwear she is on? Maybe she went to
mm,
some party and she had some footwear. Maybe her job nature is like that one. She is having she have to wear. So here reflects she her job nature is that one. So we have to make sure that we are going to write down one letter to the employee to the employer that she have to be abstain from high heels. Okay, and she have to wear
mm,
some comfortable shoes.
okay.
Okay. And whenever you're going to manage the patient, it is very especially you have to talk about very simple terms. Okay. And you use two-time double-barrel questions. If you're asking about what is the nature of the pain, and you itself you told that sharp pain, dull pain. No, doctor, it shouldn't be it should not be like this. Okay, you have to tell what kind of nature, what type of pain, and what kind of nature. So patient SP will tell you.
Okay.
Okay, so this kind of thing you have to make sure that you should not use. Otherwise, your data gathering is okay, good for me. And when you're talking about management, that was good sentence that you talk about. You took patient consent. That is important. Again, everyone is using, can you tell me, please take out this sentence till the OSCE exam. After OSCE exam, once you pass, inshallah, you can use in your daily practice. Can you tell me? But now you have to tell, may I know. You have to use word, may I know, more appropriate word.
Okay.
Yes, please. Okay. May I know, is that okay? Are you comfortable to tell me, or is that okay for to know about your condition? So it means like it is requesting way. So here you're going to take the patient consent before asking. Can you tell me? Means it's interrogative. You're interrogating the
Mm,
patient as a
yeah.
policeman. Okay. So please take out this sentence. Okay, because this kind of sentences might affect your marking system. Okay, because exam is based on total marking system, not on a single case based.
Mm,
Okay, now conservative measurement is so measures are more important here, and this is the first line: activity modification. Okay, running,
mm,
jumping. Okay, we have to temporarily reduce high impact activities. Okay, encourage low impact alternative like say cycling or swimming she can do. Footwear and orthotics. Supportive cushion shoes. Avoid thin, flat or unsupportive footwear. Consider uh, you have to consider that patient comfort level, okay? Consider heel pads or arch supports or off-the-shelf orthotics insoles are available. So you can say whatever convenient, okay? You guys on for the work you have to discuss practical footwear modification, okay? As I told you earlier. Now, stretching and strengthening exercise. This is another part of for the scenario where we have to tell about plantar fasciitis stretches. Okay, for example, sitting, crossing legs, pulling toes, back to stretch,
Yeah.
fascia, holding for 20 to 30 seconds, repeating regularly. Then calf stretches, doctor, wall or step stretches to improve the ankle dorsiflexion, and morning stretches before first steps out of the bed. Keep a towel by the bed. Okay. This is we call it position holder technique. So if you are talking about and eyes and simple self care, eyes massage like say rolling foot over the cooled water
Or
or can
yeah.
for 10 to 15 minutes, especially after activity, and avoid prolonged barefoot walking on hard surfaces at home. Yes, here you can say that if like say patient living near to beach or sandy area, you can say on a weekend you can go and walk on the barefoot on the sand. Okay, a barefoot on the beach.
Okay.
Yes, baseline is always paracetamol, not NSAIDs. Okay, only we can offer topical first if there is no contraindication. Oral antacid only we can give her for short time, but not a first line. Okay, again follow the local guidelines, please. So that's it from my side, doctor. So you want to add anything?
Dr. Imran,
Yes, doctor.
actually, I was confused. I was just about to say all these exercise, but I was confused that should we tell this patient or should we refer to the physiotherapist and he will tell us?
Doctor, first of all, doctor, there we call it money management or what you call it, cost effective thing. MRCGP South Asia orientation program. Again, I'm taking that, quoting that sentence, Dr. Hemant. He used to say that, Doctor, we are living in a third world country where we don't have this kind of gadgets and fantasies, like say smoking cessation clinics, physiotherapies, and something. Here, everything they wanted to see from the GP side. Okay, until unless there is no harm. For example, this case, if you are saying this tricks and tips, for example, is rolling a towel, ice cubes, and other things. These are the GP based management plan rather than a specialist management plan. Okay. Yes. If it is not getting better, second step always is a referral. When you're going to refer, again, let me tell you, if patient systems persist beyond or around 6 months, doctor, despite optimized conservative management. Number two, when you're having diagnostic uncertainty or patient having atypical feature or you suspect of another cause like say stress fracture, maybe he is giving history of fell down, maybe inflammatory arthritis, you think about other joints also involved, so you think about some sort of inflammatory arthritis, or patient having fever, you might think about infection, or patient having weight loss, an elderly patient, you think about malignancy or some sort of mass. Okay. Then, or significant functional impairment affecting ability to work. Doctor, patient can't stand because she is working on the airport, or maybe she is an air hostess. Okay. Okay. So you have to talk about and referral option, doctor. This is we call it physiotherapy. Is the first tier referral. Okay. Yes, you can refer, but before referring, you have to try other things.
Okay.
Okay. Number two, doctor, orthopedics or rheumatology if you're concerned about structural pathology or inflammatory disease.
Hmm.
Okay. Now, arise question, doctor, when to refer? For example, if you think that I'm going to refer this patient as an urgent referral. So, urgent referral, doctor, if patient having severe heel pain with a systemic upset, like say patient having fever, inability to wear weight beard, considering infection, fracture, or DVT differential. Think about, doctor, I can't walk more than 4 steps.
Hmm.
Okay, I can't bear my weight on that limb. So yes, and patient having night pain or red flags featuring for malignancy, doctor. Okay, these are the
Okay.
things where we are going to refer the patient. Okay, so this is a simple things are there. Always go in a way that you touch each and everything, but it should not be in a detail. But this I am giving you in a detail that at least everyone wherever they get comfortable, they can pick up that some sentence or point, so they can use it in their own your practice. Okay, doctor, from your
Okay.
side, anything?
No, almost all. Just the footwear is very important, and the diet was missed.
Yes, doctor.
Yeah.
Dr. Imran,
Yes, doctor.
only one question for clarification. Can we give in this patient steroid locally or no?
No, doctor. First line is paracetamol and topical NSAIDs. Then that first line again is what we call it conservative measures are there. Okay, there's NSAID, steroid. There is no role of steroids. Sir.
Okay. The second line can be or not?
Doctor, second line again. Let me tell you, second line again. It is not if like say the patient having more than 6 month history, then we are going to refer the patient.
Okay.
Yeah.
Thank
Yes, about the carpal tunnel, yes, you can give. Here, you cannot give. Okay, so doctor, what's next?
Okay, so next case is um, case number 9.
Mhm.
Okay, so your patient is 40 years old. Mrs. Shaista came to discuss her problem with you. Please proceed with history and management plan. Examination is closed.
Okay, Dr. Fareen, start. Okay, start, doctor. Dr. Fareen, are you
Dr.
there?
Pareen,
Hello.
Yes, doctor. Okay,
Okay.
doctor, start.
Okay. Good morning, Miss Shaista. I'm Dr. Farheen. How can I help you today?
Uh,
doctor, actually, I started on these medications, but I can still not sleep.
Okay, Miss Shaista, can you tell me more about it?
Yes, doctor, it's been going on for a week now, and I feel groggy in the morning, and I'm really working hard to sleep at night. But I don't know. I feel like this is not enough for me, and I want to increase the dose of this medication.
Okay, Mrs. Shaista, so sorry to hear about that. Mrs. Shaista, can you tell me which medicine are you taking?
Amitriptyline,
Amitriptyline. So you are taking, since how many days are you taking this medicine?
1 week.
Okay, so who prescribed you this medicine, Miss Shaista?
I had a psychiatry follow-up, and they told me I need this medication, and they said it will improve my sleep.
Okay, so do you have any sleep problem? That's why doctor prescribed you this medicine, or any other psychiatric problem?
No, doctor, I wasn't sleeping properly, and it was affecting my life, my job, and then I went to this psychiatrist, and he said I need this medication.
Okay. Okay, so Mrs. Shaista, is so you told me you are taking this medicine since 1 week, right?
Yes, doctor.
And do you have you noticed any change after taking this drug, like your sleep improve or not?
No, doctor, not even a bit.
Okay, okay. So Mrs. Shaista, can you tell me, do you have any within the past 2 weeks? Do you feel low mood?
Doctor, I'm irritable all the time because I cannot sleep at night, and that's why I'm irritable.
Mm-hmm. And do you have any complaint of decreased pleasure or interest in daily activities nowadays?
I had the loss of interest a little bit, but it's okay. I still enjoy the things with my kid.
Okay. Okay. So, Mrs. Shaista, can you just tell me just before 1 week, is there anything, any event happened in your life?
No, doctor. I was suffering from sleeplessness since last 6 months, and I was taking antihistamine medication for sedation, and then they put me on amitriptyline.
Okay. Okay. So, Mrs. Shaista, can you just tell me what about your mood?
My mood is fine these days, but again
Hmm.
irritable.
And what about your appetite?
It's fine.
Okay. Okay. So, Mrs. Shaista, tell me, do you have any long-standing illness?
No, doctor.
Mm-hmm. And are you taking any other drugs apart from amitriptyline regularly?
No, no, doctor.
Okay. So, Mrs. Shaista, is any member of your family affected with the similar type of illness?
Doctor, my mother used to have some anxiety problems.
Mm-hmm. Okay. Okay. So, Mrs. Shaista, how she's your mother? She's now?
She's taking medications.
Okay. Okay. So, Mrs. Shaista, can you just tell me, do you have any drug allergies?
No, doctor.
Mm-hmm. And have you noticed any racing of your heart?
No, doctor.
Any difficulty in swallowing food?
No, doctor.
Any fear of dying?
No, doctor.
Okay. So, Mrs. Shaista, can you just tell me what do you do for living?
I work in a bank.
Sorry?
I work in a bank as a bank manager.
Bank manager. Okay. So, Mrs. Shaista, may I know that how this thing affect your work?
Doctor, all the night I'm trying to sleep, and when it's morning, I'm getting bit of sleep, then sleepy all day in job. It's affecting me.
Okay, okay. So, Mrs. Shaista, I can understand that how difficult must be it's for you. Mrs. Shaista, can you tell me that do you smoke?
Yes, doctor, 10 cigarettes a day.
Okay. Have you ever tried to quit it?
No, doctor.
Okay. Mrs. Shaista, how about just try to quit it? You know, it's not good for your health. If you ever make up your mind, just let me know and we will discuss how to quit it. Is that okay?
Sure, doctor, I'll try.
Okay. So, Mrs. Shaista, just tell me, do you take alcohol?
Yes, doctor, on weekends.
Mm-hmm. And have you ever tried to cut it down?
No, doctor.
Okay. Okay. So, Mrs. Shaista, we will discuss this thing later. Ms. Shaista, do you take any other recreation drugs?
No, doctor.
Okay. And can you just tell me that what's your last BMI?
32.
Okay. And have you ever tried to lose your weight as your BMI is on the higher side?
Doctor, my job is 9 to 5. I hardly get time.
Okay. Okay. So, Mrs. Shaista, are you married?
Yes, doctor.
Mm-hmm. And how's your married life? Is there any stressor in your life going on?
Um, my husband stays out of the city, and I'm the only one taking care of my kids. Otherwise, everything is fine.
Okay, okay. So, Mrs. Shaista, I can understand that how difficult must be for you that took care of your child, take care of your child without husband. Okay, so Mrs. Shaista, can you just tell me like what's your last menstrual period?
2 weeks ago,
2 weeks ago. And what's crossing your mind? What do you think?
doctor, I just need more medication. Like this 10 milligram will do nothing with me. Can you increase
Mm-hmm.
my dose?
Okay, then we will discuss this thing. And what thing worries you most, Miss Shaista?
I'm also concerned if I'm on medication, it will put me on
Okay,
addiction.
right. Okay, so Mrs. Shaista, how far this thing impact your life?
I want to sleep properly.
Okay, and what do you expect from me?
Doctor, just any dose adjustment.
Okay. Okay. So, Mrs. Shaista, I will tell you each and everything in detail. Don't worry about that. And I just want to quickly summarize it. You told me that since 1 week you are taking this drug, amitriptyline, 10 milligram, and you are still facing this sleep problem, and you are unable to sleep properly, and this badly affect your work, and you are so worried about this, and you want to increase me the dose of this drug. Is there anything else you want to add?
No, doctor, only this.
Okay. So, is examination required?
Gray.
Okay. Okay. So, Mrs. Shaista, after taking history and um, after taking history, I'm suspecting that you have a condition which is called insomnia. Do you have any idea about that?
No, doctor.
Okay, so it is basically a condition in which there is the difficulty to sleep, and there are several reasons behind this. Like maybe your sleep pattern is not proper, and is there any stressors in your life? So we have to do some of the management, like lifestyle modification and medical management. Is that okay?
Sure, doctor.
Okay, so Mrs. Shaista, I just want to ask one more question. That how's your sleep pattern? Like when will you go to the sleep daily at the night?
Mm, I go at around 10 or 11.
Okay, and okay, so Mrs. Shaista, I'm just offer you lifestyle modification. First, what you have to do, just take some time out, go for a walk, and just relax yourself. Don't take too much stress. How about that?
That sounds fine.
Okay, and that's really good. And just go to the sleep every day at the same time, like go to at least 9 o'clock at night. Okay, and at least same day at every day. Is that okay?
Sure, doctor, I'll try.
And also avoid any distractors in your room, like any TV, mobile phone, and anything else. How about that?
Okay, doctor, I'll try this.
Okay. And as you are taking smoking and alcohol, this will aggravate your, disturb your sleep. So try to cut down the alcohol and try to quit smoking. Is that okay? Can you do this?
Sure, doctor, I'll try.
Okay. I'm giving you a leaflet about this. Each and everything is mentioned in detail about. Is that okay, Miss?
Okay, doctor.
Okay, moreover, I'm just changing your drug, which is you are taking amitriptyline. I'm giving you zolpidem, 10 milligram. You have to take it for 2 weeks. Okay. And first thing I just want to ask, are you breastfed?
No, doctor.
Okay. So you can take this for 2 weeks and just follow up after the 2 weeks, and I will check if this drug is suited, if it will give you relief or not. How
Time
about
up.
that?
Okay,
Okay.
doctor.
Uh, okay, Dr. Farheen. Uh, this case was again a tricky case, as like others.
I'm just confused that.
Okay, doctor, he started the medication how long before? 1 week, is it?
1 week back.
Yes.
Yes, doctor. Now let me tell you. In the management plan, doctor, we have to explain that this medication is not a traditional medication like sleeping tablet, okay? It takes
Yeah.
more than a week to notice any benefit. This one you have to tell the patient and emphasize that tablets are only one part of the broader plan. It's not solely the solution. How are you going to explain that? You can say, Mrs. Khan, the tablet I give you is actually an older antidepressant that is in the low dose, can make some people feel sleepier at night. It usually take at least one couple of weeks, at least like say couple of weeks, to judge whether it is helpful, and it works better alongside the good sleep habits. You can say that I would not want to keep increasing the dose quickly because of side effects and the risk if you ever took too many. Okay,
Yes.
now addressing patients' adherence, dose, and side effect, which is a main pillar of a total management in this case. If the patient has taken it correctly with a minimal side effect, okay, we have to consider continuing the same low dose for another 1 to 2 weeks before judging efficacy, provided it is safe and in the line of local policy. Again, I'm talking about local guidelines. Please follow that one. If side effects are troublesome or taken and there are some risk factors are there, Consider stopping amitriptyline and focusing on non-drug measures or alternative options. But mostly in exam, Dr. Fareen, we can say
Yes.
that given that it has only been a week that you are not having any worrying side effect, I suggest we give it little longer, about another week. What do you think about it? Or two? Is that okay, Mrs. Khan? While working hard on your sleep routine. Okay, we will review you again. If it is not helping, we can look at other options. How it sounds. Okay.
So, Dr.
If
Imran,
like
can we give amitriptyline for sleep problems also?
Doctor, that's what I'm coming to you, and that's what I'm coming. Okay, because it's not for
Yeah.
sleep. As I told you, that's not only
Yeah.
my tablet is not a part of full total
That's why
part.
I
Okay,
switched
this is
this
a
back
broader
to
plan.
other.
Yes, doctor, and if not appropriate to continue, so you can say that you have had quite a few side effects. I am not convinced that this medication is helping you sleep. I think it would be safer to stop and focus on other techniques to improve your sleep. Okay, and we can also address the underlying stress and low mood. What was the stressor was there? What was the problem with Mrs. Khan? So we have to look into that one. Okay, then non-pharmacological, we have to. This is a core context, core exam context. Okay, the non-pharmacological management. You have to go through the practical, specific sleep hygiene and CBT style strategies, doctor. Okay, as you told
Okay.
that a regular bed and wake up time even on day off. Okay, wind down routine for 30 to 60 minutes before bed. Quiet, no screen, relaxing activities. If she's using a lot of screen timing is there, so there is a blue rays effect is there. And reserve the bed for sleep and intimacy only. Avoid TV and mobile phone in the bed. Okay, avoid
Mhm.
caffeine at least 6 hours before bedtime. Limit alcohol if she's taking, and no and nicotine in the evening. And manage daytime naps. Ideally, avoid or limit to brief only early naps recommended. If unable to sleep after 20 to 30 minutes, get up, do a quiet activity, and return to bed only when sleepy.
Okay.
Okay. If patient has having the pain, nocturia, reflux, etc., we have to address as appropriate, and we have to signpost for CBT for insomnia
So,
or
Dr. Imran, right now, okay, sorry.
yeah. CBT for insomnia or online CBT based program, or as you told that leaflets.
Okay.
Okay. And review for underlying condition. For example, any condition. If like say patient having depression, patient having anxiety, patient because of the pain not sleeping, all contributing conditions are there. So as per the scenario, doctor, you have to act. It's not a like say universal scenario. It's a universal management. As per the scenario, you have to tweak around. Okay. Um, and after that, arrange follow-up in 2 to 4 weeks. If sooner, if there is a high patient is high risk. Safety netting if symptom was getting worse. Yeah, Dr. Fareen, what you want to say?
Should I send this patient CBD on the first visit, like I have tell all the non-pharma and all the sleep hygiene, or should I wait that for on the next visit if your symptoms are not controlled, then I will send you for the
Yes, doctor, you have
CBD.
to wait for. Yes, doctor, if patient don't have that much severe symptoms as you think that his patient don't have, so we can wait for
Yes.
1 week. Okay, but
Okay.
why she's not getting sleep? Is there any TV in the room, mobile phone usage, work from
Yeah.
home, using laptop? Okay, small child at home, or some noisy environment around surrounding. Okay, and she's living in a sharing environment. There is some sort of someone is wanted to use the light and she can't sleep in the light. Okay, so there are many factors are
Okay.
there, doctor. Stress going on.
Okay.
So we have to see what kind of a stress, what is the reason behind sleep, not getting sleep.
Yeah. Okay.
Okay. So,
Mhm.
doctor, from your side, anything?
Yeah, almost told, but the diet again missed because she was
Yeah.
taking too much caffeine before bed.
Mhm.
Okay.
Okay, doctor. So, next case.
Doctor, is it case number 10? Case number 10.
Okay. Okay, case number 10.
Yes.
Okay, start.
So your patient is Mrs. Fatma came to discuss her problem with you. Please, 28 years old. Please proceed with history, examination, and management plan.
Okay. Should I start?
Start, doctor.
Good morning, Mrs. Fatma. I'm Dr. Farheen. How can I help you today?
And doctor, my tummy is again acting weird.
Mrs. Fatma, can you tell me more about it?
Yes, doctor. Since last 1 week, I'm having this uh, loose stools again.
Okay. Mrs. Fatma, so sorry to hear about that. Can I ask few more questions? Is that okay?
So, doctor.
You told me that since last 1 week you are having loose stools, right?
Yes, doctor.
So can you tell me exactly how many stools per day you have passed?
6 to 8.
6 to 8. Okay. So, Mrs. Fatma, can you just tell me what is the consistency of these stool? Like, is it semi-solid or it is just watery?
It's doctor. Loose stools. Semi-solid, you can say.
Okay. And Mrs. Fatma, have you noticed any blood in it?
Yes, doctor. Every time I get these loose stools, I'm getting blood in it because I have this condition of intestine. I don't remember its name.
Okay, so it means that you are a diagnosed case of something, some condition like Crohn's or ulcerative colitis, maybe?
Yes, doctor. Yes, that ulcerative colitis.
Ulcerative colitis. Okay. Okay, so Mrs. Fatma, may I ask that when you were diagnosed with this disease?
Almost an year now.
Okay. And how's things going like since 1 year? Did you go for any checkup?
Yes, doctor. They put me on medication, and I'm taking it daily.
Mm-hmm. So are you taking it regularly or you skip your medicine occasionally?
Yes, doctor. Since this 1 week, I was having exams, and that's
Mm.
how I skipped the doses.
Okay. Okay. So Mrs. Fatma, just tell me, do you have any abdominal pain, tummy pain?
Yes, every time I have this bloody stool, I get this crampy pain.
Mm-hmm. Have you noticed any lump in your tummy?
No, doctor.
Okay. And have you noticed any rashes on your body?
No, doctor.
Okay. And Mrs. Fatma, have you noticed any yellowish discoloration of your skin?
No, doc. No, doctor.
Okay. Any history of itching?
No, doctor.
Mm-hmm. Okay. So Mrs. Fatma, can you just tell me, do you have any history of vomiting?
No, doctor.
Any history of recent travel?
No, doctor.
Okay. So, Mrs. Fatma, you told me that you are having this problem since 1 week. So, did you take any other medicine?
Um, just I'm taking the regular medication, ASA.
Mm-hmm. Okay. And you told me that since 1 week you are not taking it regularly, right?
Yeah, on and off.
Okay. Okay. So, Mrs. Fatma, just tell me, do you have any joint pain?
No, doctor.
Okay. Do you have any other long-standing illness?
Mm, no, doctor.
Okay. And is any member of your family affected with the similar illness?
Yes, my dad had similar bowel problem.
Okay. And how he is now?
He's better on medications.
Okay. Okay. So, Mrs. Fatma, just tell me, do you have any drug allergies?
No, doctor.
Okay. Any history of hospitalization before?
No, doctor.
Okay. So, Ms. Fatma, what do you do for a living?
Doctor, I'm a student.
Mm-hmm. And how's everything in your life? Like any type of stressors? You told me that your exam is going on. Anything else?
Yes. No, doctor, only this.
Okay. Okay. So, Mrs. Fatma, I can understand that it must be difficult for you to manage these studies and this diarrhea. And can you just tell me, do you smoke?
No, doctor.
Do you take alcohol?
No, doctor.
Any other recreational drugs?
No, doctor.
Okay. So, Mrs. Fatma, what's your last BMI? Do you have any idea?
It's 23,
23. And what's your last menstrual period?
2 weeks ago.
2 weeks ago. What about your diet?
I'm taking a good diet.
Mm-hmm. And nowadays, since 1 week, are you feeling lethargic and weak?
So yes, doctor, every time I have these stools, I feel lethargic.
Mm-hmm. Okay. So, Mrs. Fatma, just tell me, who do you live with?
I live alone in hostels.
Okay. And is there any stressor in your life?
No, doctor, only my exam.
Okay. Okay. So, Mrs. Fatma, just tell me about, I can understand. Just tell me what's crossing your mind.
It's another flare, doctor.
Okay, I will tell you each and everything in detail. Don't worry about that. And what thing worries you most?
Doctor, it's just I don't know if it will keep on going like this. I don't want any hospital admissions.
Right, right. Okay. So, Miss Fatma, don't worry. Just tell me what do you expect from me?
Any medications, doctor? Any additional medicines?
Okay. And how far this thing impact your life, Miss Fatma?
Doctor, I'm just worried because these my I have to give assignments and do some study work. Because of this, I cannot do anything.
Okay, okay, Mrs. Fatma, I can understand that this must be really frustrating for you. I just want to quickly summarize it. You told me that since 1 week you are having this diarrhea and with bloody stool and with abdominal pain, and you are a diagnosed case of ulcerative colitis since 1 year, and you are so worried you don't need any further hospitalization. Is there anything else you want to add?
No, doctor, only this.
Okay, so Mrs. Fatma, I just want to quickly examine you. Is that okay?
Sure, doctor.
Okay. In the presence of the saffron and after sanitizing my hand, I will start my examination. I will start with the checking the vitals first and checking the general physical examination, sign of anemia, jaundice, sign of dehydration, and checking the sunken eyes and also checking the mouth mucosa and skin pinch. And I will also check the basis of the lungs and palpate the abdomen with superficial. I will first inspect the abdomen, then superficial, and then deep palpation for the any abdominal mass. I will also examine in the presence of the chaperone the back passage of the back passage, and I will also check edema.
Okay, so vitals normal, 100/60 blood pressure, abdomen with tenderness present, generalized tenderness, otherwise normal.
Okay. Okay, so Mrs. Fatma, I just want to, after taking your history and after examining you, I'm suspecting that most probably you have a condition which is called flare of ulcerative colitis. Okay, do you have any idea? Hello?
Hello?
Hello. Okay.
Yes,
So,
doctor.
do you have any idea that what this is? The flare of ulcerative colitis.
Yes, doctor, I had it before. Also, I know.
Okay. Okay. So basically, Mrs. Fatma, in your case, the flare is just because you are not taking your medicine regularly since 1 week, right? So that's why you are having this problem with bloody diarrhea and since 1 week. Are you getting my point?
Yes, doctor.
So I'm just offering you a few of the investigations that include CBC, ESR, CRP. Is that okay? Hello?
Sure, doctor.
Yes, doctor.
Okay. Okay, so right now, as your condition is serious and this is the severe type of the flare, so I'm just make a referral letter for you and I'm just refer you to the emergency department right now. How about that?
Doctor, but can you give me medication? I want to go home. I don't want admission.
Okay, I can understand, Mrs. Fatma, that your condition, but right now you need hospital admission because this is something serious, and I'm just also passing the IV cannula in case of the severe dehydration. I can give you pass the IV cannula, and then I will just refer you to the emergency department. How about that?
Okay, doctor.
Okay. Is there anyone else with you?
No, I came alone.
Okay, so can you just give me a number so I can contact with your family members and tell each and everything in detail?
Yes, doctor, but what about my exams and my
Time up.
assignments? Who will take care of it?
Time up.
Okay.
So, doctor, you admitted this patient, am I right? Okay.
Yes.
So, what are the points you admitted the patient?
Actually, it's a diarrhea 6 to 8 episodes per since 1 week. So I just think that it's a severe. That's why I just refer this patient.
Okay. And what was the examination done, doctor?
Examination is normal.
No, what examination you done?
Yeah,
The
examination I have checked the sign of dehydration and abdominal examination, back passage examination.
Okay. And have you verbalized this thing that I'm going to inspect, palpate, percuss, and sounds, auscultate?
No.
Okay, doctor, you have to make it habit, okay? Whenever you do, because here, if you do the practice, what will happen? It will help you in the exam that you can say, Miss Khan, I'm going to examine you. Is it okay for you in the help of Shafan? So I'm going to see general physical examination where I'll be looking your appearance and we'll be looking the stress and hydration and pallor status. Followed by I'm going to observe like say temperature, pulse, blood pressure, respiratory rate, oxygen saturation, weight according to the height. And may I expose you up till the up till the rib, sorry, in middle of the chest. Okay. Uh,
Okay.
there you have to say that I'm going to first I will be inspecting your chest, inspecting your abdomen, palpation, then percussion, then bowel sounds. Okay, and then I'll be checking your perineal and back passage area.
Okay.
Okay, so this is why I was looking at your examination. That's why I asked the few points from that side. Admission, yes, she required admission. Okay,
Yeah.
and in case, for example, it is a moderate flare. Okay,
In case
mostly
of moderate flare, should we give a steroid and with the help of a specialist and then refer?
yes, doctor. We should not say that I'm going to give you steroid. I'm going to talk to the specialist or your treating
Yeah.
doctor.
Yes.
Okay, and then you can say. Otherwise, case was good from my side.
But I just forgot safety netting.
Safety net, doctor, I told you guys that please don't emphasize on that because they already told that if you forget safety netting, you'll be running out of time. You say in my exam real doctor first my first scenario was good and it was completed almost 10 minutes and bell rang. I said okay, if your symptom getting worse while walking away, I told if your symptom getting worse come back to me, that's it. I just touched the safety netting. It doesn't mean that I'm going to explain that if your other red flags and other thing. No, doctor, I just said that thing and it was done. So this is a trick I'm telling you. When you're running short of time, you say if your symptom getting worse and please come back to us, that's it. Safety
Okay.
netting is not, doctor. There is a lot of things are there. Many times we have found that we are following that strict, lines of rules and something. No, doctor. We have to this OSCE based on not something that what you are doing, based on how safe you are, doctor.
Okay.
Okay. Yes, doctor. And how you are managing the time.
Yeah.
Why it is 10 minutes? Because 10 minute logically for South Asia where you have to see 60 to 70 patient in OPD in your whole time in 8 hours. So they wanted to know about how you are distributing the time. That's it. So doctor, that's it from my side. Anything and you wanted to add?
Just yes, one important thing. When the patient is coming, like he or she is a student, they will ask you regarding the sick leave or who will be taking care. because usually it's not considered a lot. So we will tell I am writing to your college regarding your condition, and they will be considering it. So the letter to the college is important. Otherwise, it was all fine. But
Okay. Thank you.
thank you. It was third case, Dr. Farid, right?
Yeah, third. Yeah, yeah.
Yes.
Okay.
So now
So
Dr.
next is
Maida.
Dr. Yeah.
Yes, doctor.
Okay. So case number 6.
Okay, doctor. Six.
Your patient is
Okay, doctor.
Mr. Khan. Mr. Khan, 32 years old male, came to discuss his problem with you. Please proceed with history examination and management plan.
Okay. Should I start?
Yes, doctor.
Hi, good morning,
Start.
Mr. Khan. I am Dr. Maida here. How can I help you today?
Doctor, I have this bad diarrhea.
Okay, Mr. Khan. May I know something more about it?
Yes, doctor, it's been going for a while now, and I'm having
Hmm.
this bloating for weeks, and also
Hmm.
this loose stools, and I'm feeling weaker and weaker these days.
Okay. Mr. Khan, is it okay if I will ask you more questions about your condition?
Sure, sure, doctor.
Okay. May I know that since how long you have been diarrhea, as you said?
It's been 3 weeks now.
3 weeks now. And may I know that did you consume some food from outside before having this diarrhea?
I don't remember taking food from outside, but
Hmm. Okay.
doctor, I'm already taking from takeaways.
Takeaways. Okay. May I know that how many stools you have been passing per day?
Yeah, it's 2 to 3.
2 to 3. And is it? May I know about consistency of stool? Is it watery, like semi-solid, or what?
It's greasy kind of diarrhea, doctor.
Okay, greasy kind of. Is it difficult to flush?
No, doctor, not a lot, but it has
Okay,
bad
is
smell.
bad smell. Okay. May I know that do you feel any abdominal pain with diarrhea?
Uh, no, doctor, only bloating.
Bloating. And do you feel that
Sometimes this pain, sometimes I
hmm,
feel pain, also cramping pain.
okay, cramping pain. Okay. Anything which makes your diarrhea better?
No, doctor, I was just taking this oral rehydration, but
Okay,
I'm not
ORS.
getting better. Yeah.
Okay. And anything which makes your diarrhea more bad? Any food, particular food?
No, doctor, it's normal.
Okay. Okay.
Mm,
Did you notice any blood with diarrhea?
and no, doctor,
Okay. Any mucus in diarrhea?
no, doctor.
Okay. May I know that did you travel recently somewhere?
Yes, doctor, I came back from Nepal.
Okay. And may I know your routine that what was your dietary routine there in Nepal?
We were taking from outside, and mostly we were
Hmm.
camping and going out in the fields, and also
Hmm.
we went for swimming.
Okay. 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 And do you feel any nausea also with this diarrhea?
Sometimes, yes.
Okay. Any weight loss with this diarrhea?
No, doctor, not that I know of.
Hmm. Okay. And did you notice any dizziness or like lethargy with this diarrhea?
Yes, doctor. Yes, doctor, I do
Okay.
feel.
Okay. Anyone else in your friends or family also had this same type of complaint?
Yes, doctor, the friends that went with me to the Nepal, they have the similar condition.
Okay. And may I know that you use some medication or you consulted some doctor for this problem?
We just took this ORS, Nothing else.
Okay, okay. And may I know that do you have any other long-standing illness for which you are taking any medication?
Mm, no, doctor.
Okay. And uh, mm, uh, so you are not on any regular medication?
No, doctor.
Hmm. Okay. And then tell me that which kind of diet you are taking nowadays?
I'm taking normal diet, mostly semi-solid food.
Semi-solid food. Okay. Do you consume alcohol also?
Little bit.
Okay. May I know what about your smoking, if you have been smoking?
Yes, doctor. I smoke 10 cigarettes a day.
Okay. And for how long you have been smoking?
Um, doctor, it's been 10 years now.
10 years. Okay. Did you ever think about quitting smoking?
No, doctor.
Okay. And Mr. Ahmed, we will talk about it after at the end of the session. If you are interested, I will give you a leaflet. You can go through it and we can discuss about quitting smoking. We can have another session about it. Is it okay for you?
Yes, doctor.
Okay. Mr. Ahmed, I would like to know that did you use any recreational drug?
No, doctor.
Okay. What about your, like, are you married?
Yes, doctor.
Okay. And how about your, everything okay at home?
Yes, doctor. Everything is fine.
Hmm. And what do you do for your living?
I'm an active worker.
IT worker. And any stresses in life?
No, doctor.
Okay. May I know that what do you think that what's going on with you?
Doctor, I feel like it's a kind of bug, maybe.
Could be. And what is your main concern today?
I want any long-term, um, it could be a long-term gut damage or something
Hmm.
like serious like cancer.
I hope not. Okay, tell me, Mr. Ahmed, that how it is impacting your life.
Doctor, I cannot do my daily work I used to, I
Hmm.
feel dizzy all the time.
And what do you expect from today's consultation?
Any stool test or any antibiotics needed?
Okay, sure. We will discuss about it. Mr. Ahmed, may I know that how much is your body weight and height?
It's 24.
Okay. Mr. Ahmed, I would like to summarize you. It's been 2 to 3 weeks. You have, after you return from your travel, you have been suffering from diarrhea. It's 3 to 4 times per day. It's foul smelling, and you are worried that it could be some serious condition, and you want me to diagnose and give you some antibiotic if needed to relieve you. And it's badly impacting your life. Am I okay?
Yes, doctor.
Okay. Mr. Ahmed, will you allow me to have a quick examination for you?
Sure, doctor.
Okay, thank you. I will sanitize my hand under complete privacy. I will do your general physical examination after taking your pulse, blood pressure, and temperature. I will check your hydration status. I will check your central cyanosis, your anemia, jaundice, and your skin turgor. Then I will check. I will ask you to please expose your tummy. I will inspect. Then I will gently palpate, and then I will palpate deep palpation for any tenderness. Especially, I will focus on liver and spleen, and all. I will palpate all the areas. Then I will auscultate for abdominal sounds. I will ask. I will also request you to let me examine your back passage. I will inspect your lower limbs also for any edema. So, if there any positive finding, please let me know.
Signs of dehydration present and
Hmm.
mild diffuse tenderness but no
Hmm.
guarding.
Okay. Mr. Ahmed, I would like to send few of your investigation, which include CBC, ESR, CRP, liver function test, electrolyte, and also I want to do a stool culture because it's been a long time that you have been facing this diarrhea and antigen for giardia. Is it okay for you? Can you do these tests?
Giardia positive.
Giardia positive. Mr. Ahmed, based upon your history, examination, and investigation, which I just came to know, looks like that you have been suffering from chronic diarrhea, and on your investigation, the Giardia is positive. Do you know about what is Giardia?
No, doctor.
Okay, actually, as you are right that you have been thinking, as you were thinking that some bug have entered in your stomach. That's you're right. During your travel, maybe it's due to some unhygienic food. The Giardia is a bacteria which entered in your stomach, and it causes prolonged diarrhea with too much flatulence. So this is the condition which you have been suffering. But don't worry, we can treat it with some lifestyle modification, some dietary modification, and some medicine. So should I tell you all these things? Is it okay?
Sure, doctor.
Okay, Mr. Ahmed, first of all, please continue your lifestyle modification. Drink lot of water, hydrate yourself, wash your hands before and after having food, and don't serve food to other people. Take soft diet, continue soft diet. Take continue ORS, and for treatment of your giardia, I will give you after your culture, I will give you an antibiotic which is metronidazole. So 400 milligram 3 times a day with water. It
Okay,
will
time up,
give you bad taste.
Dr. Maida.
Okay.
Okay, doctor, in the history, you touched almost core points, which was not, which was required actually. You were covered that symptoms and exposure and risk factors, but in the red flags also you've gone through background and impact. You have asked examination. Yes, was perfect. Now, in the MRCGP setting, doctor, in here we have many points to think about this case. Okay, we have to think broadly,
Yes.
from infective diarrhea to bacterial to viral,
Mm.
post-infectious IBS, celiac
Mm.
disease, inflammatory bowel disease, lactose intolerance, primary or secondary might be, pancreatic
Mm.
insufficiency, and chronic pancreatitis a patient having steatoria, and
Mm.
functional GI disorder like the IBS. Okay. Now, key distinguishing points are there from all in giardiasis. Long-standing non-bloody diarrhea, bloating, flatulence, travel, and water exposure. These are the things like say often normal inflammatory markers will be there. Everything will be normal except patient will be having stool test positive, stool positive. Huh? Management, it will be again, first of all, it is supportive care. Oral dehydration, simple dietary advice, small frequent meals, avoid very fatty and spicy food during acute phase, and considering temporary lactose restriction here. This is the important part. Many of us, we give what you call it, yogurt. Okay. And if post-infectious or malabsorption symptoms are there, so we have to stop lactose restriction. Okay. We have to tell to stop taking lactose. And first line again, rightly said, metronidazole, standard overdose dosage, we have to say that I will be giving for 7 days. And alternative depending on availability and local guidelines. Again, there is a tinidazole. In some guidelines they are giving, but still metronidazole having upper hand. And key point as a GP, we have to confirm the diagnosis with stool test where possible. But in classical cases with delay or lab testing, starting empirical treatment may be reasonable. If, like, say, your local guidelines suspecting, for example, in our Pakistan, India, okay, we can say empirically, I'm suspecting this thing, I'm sending stool test. For example, examiners say that the stool test is pending. Huh? We have to emphasize adherence to the full course of the medication treatment
Mm.
and warn
Mm.
about common side effects like say metallic taste in the mouth. For example, if I'm giving them metronidazole, nausea, vomiting, and GI upset, and during taking the, for example, if patient agenda is a patient taking alcohol, strictly no alcohol during this one,
Mm.
or at least for 848 hours after the course.
Mm.
Okay, so this is the thing, and most important, household contacts and public health. This is the one of the
Mm.
most important thing. If you have done treatment, but you forgot household contacts and public health mentioning. Examiner will not give you good marks. Okay, examiner might say that it's a incomplete, huh? We have to explain about good hygiene after toileting and before food, or if patient having two bathrooms, two washrooms or toilets are there, so we have to tell one washroom should be for you only, and do not share the towels, funnels, and toothbrushes. Clean bathrooms and toilets after using regularly, and children with confirmed giardiasis may need to be kept off nursery if, like say, case come as a child from the school at least 24 to 48 hours after symptoms stop. So again, it is a local guideline you have to follow and treat symptomatic um, close contact as advised by the local guidelines. Again, you have to follow. Because I have, doctor, I think one PDF file I have shared in a previous my group. I will be sharing here also a local guideline for infectious diseases. Okay, and routine screening for all symptomatic household contact if it is not always required. Okay, safety netting if symptom with getting worse, please come back to us.
Dr. Imran, in this case, his family was okay, but friends were having same symptoms. So
Yeah.
how we will do household contact tracing or screening?
Okay, so we have to say that I'm going to inform public health department in Pakistan, India, and Bangladesh. We have public health department or infection control department. Okay,
Okay.
it's not that I'm going to call them and going to test them. No, if you're running short of time, see, easiest way that I'm going to inform. I'm going to notify. That's it.
Okay.
Yes, doctor, you want to add anything?
No, doctor, all of this. Everything is covered. Okay, so next case.
Okay, doctor, what next? What is next case?
Yes, just give me a minute. Case number 3.
Case number 3, huh?
And yes, Dr. Maida, I noticed one thing. You were like, are you married? We can just ask us straight with whom we live at home.
Be sure.
Okay.
Yeah.
So your patient is a 35-year-old female, came to discuss her problem. Please proceed with history examination and management plan. Patient's name is Mrs. Hani.
Hani, okay. Hi, good morning, Miss Hani. I'm Dr. Maida here. How can I help you today?
Doctor, I have these pain since so long, and I'm getting these attacks of pain again and again.
Miss Hani, may you may I know something more about it?
Yes, doctor. Actually, it's mostly coming without me knowing, and mostly it's around the eye, and it's many times in a day, and it's been going on for weeks, and now.
Okay, Miss Hani, I'm so sorry to hear about your sufferings. Is it okay? Are you comfortable if I will ask you more questions from you?
Sure, doctor.
Okay, Miss Hani, may I know that timings of your attack? Any specific timing when you get this attack?
No, doctor. It's mostly like over the weekends. Sorry, in the weekdays.
Weekdays. Okay. Okay. Weekdays. Did you tell me that you have a pain in your eyes? I did not hear properly.
Yes, doctor. Whenever it comes, it also brings pain in my eyes also.
Okay. Okay. May I know that how much is the intensity of this pain?
Doctor, it's severe kind of pain, like 9 to 10.
9 to 10. So sorry to hear. Miss Hani, may I ask you that is it on one side or both side of your eyes?
It's one side.
One side, right side.
Yes.
Okay. And is it this eye pain moves somewhere? I mean, your head also?
Yes, doctor, on the side of the head and this in the same eye.
Okay. Miss Hani, is it, if I will ask the intensity of this pain, 0 is the minimum and 10 is the maximum? Oh, sorry, you already told me it's a 9 out of 10. May I know that, is it the pain which wakes you from sleep at night?
No, doctor, it doesn't happen to me in the morning. It mostly happens to me at night
Yes, night. Okay.
before
And does
sleeping.
it, okay, anything which makes it better?
On weekends, doctor, when I'm going to my parents' house,
Mm-hmm.
it's better.
Okay. May I know that anything which makes it worse?
I don't know, doctor. Every day when I'm going back home after meeting my friends outside, every time that then it happens.
Okay, Miss Hani. May I know that do you feel some tearing of eyes during this attack?
Yes, doctor. Some tearing and some flu-like also.
And watering from your nose?
Yes, doctor.
Okay. And do you feel that there is some nasal congestion with that?
Yes, doctor.
And may I know that is it what kind of pain it is? Is it pulsatile, throbbing, burning? What kind of pain it is?
It's just pain, sharp
Hmm.
kind of pain.
Sharp kind of pain. Does it? Did you ever notice that it makes your vision bad, like or loss of vision?
Not lost, but I feel blurry.
Blurry. Oh. And after this attack, your vision is okay. You are not more no more blurry.
Yes, doctor.
Okay. And does it cause your ear pain?
No, doctor.
By any chance, some is it like that electric kind of or sharp sensation while touching your face?
No, doctor.
Do you feel like a pain on your joint while chewing, on the sides of your
No,
mouth while
doctor.
chewing food? Okay.
No, doctor.
Do you have any tooth problem or any cavity in your tooth?
No, doctor.
Do you use refractive? I mean, do you use glasses or contact lenses?
Yes, doctor. I use contact lenses.
And have you seen your doctor for any change in your number?
No, doctor.
Okay. May I know that? Okay. Miss Hani, anyone else in your family had any, by any chance, had same kind of episodes?
Sorry.
Anyone in your family have same kind of episode?
No, no. Sorry. My father had a similar condition.
Okay. And how he is doing?
He's fine, doctor.
Okay. Miss Hani, I would like to know that do you smoke?
Yes, doctor. I do smoke.
Okay. How much
10 cigarettes a day.
and for how long?
10 years.
10 years. Miss Hani, did you ever try to quit smoking?
No, doctor.
Okay, Miss Hani, I will give you a leaflet in which some like everything is written in detail about smoking hazards. I would like you to have a read of it, discuss with me if you want. We will have another session about quitting smoking. It's very, I feel that it will be very good for you if you will discuss and we will think about quitting smoking. Is it okay for you?
Sure, doctor.
Moreover, I want to ask if you have been consuming alcohol.
Yes, doctor. I do take alcohol daily almost.
Hmm. Okay, Miss Hani, I would like to discuss with the cessation of or reducing alcohol as well after the end of the session. Is it okay?
Sure, doctor.
Okay, Miss Hani, how about recreational drugs?
No, no, doctor.
Okay, what do you think? What's going on with you?
Doctor, I feel I have a tumor in the brain.
Oh, I hope not. And is it impacting your life?
Yes, doctor. I'm going so mad because of this pain. It's
Mhm.
intolerable.
I can understand, and I think this is your major concern that it's a tumor. You're thinking it's your tumor. Am I okay?
Mm.
Hmm.
Yes, doctor.
Okay. How can I help you today?
Just give me any fast pain relief or any
Sure.
specialist.
Okay, refer to specialist. Okay, I have noticed down. Note. I will talk about it. Miss Hani, will you allow me to have a quick examination?
Sure, doctor.
Okay, Miss Ani, I will sanitize my hand under complete privacy. I will do your general physical examination, your blood pressure, pulse, temperature. I will check your back of your eyes at the end of session to check, and I will check the pressure of your eyes also. I will ask you to please clench your jaw. I will palpate your temporomandibular joint. Then I will check sensation on the side. I will check your facial nerve specifically. I will ask you to blow your mouth from your forehead and smile for me. And yes, that's it. Any positive finding?
Everything is normal. Normal
Okay.
findings.
Okay, Miss Hani, based upon your examination and history which you have given to me, looks like that you have been suffering from a condition which is called cluster headache. Are you aware of this term?
No, doctor.
Miss Hani, I would like to tell you it's a type of headache that occurs that comes in attacks, usually at one side of head, and typically occurs in like as I said in a cluster or bouts, and it remains for several weeks. Though it's very severe, but the good news is that it can be controlled with some lifestyle modification and with some treatment. Do you want me to discuss this treatment with you?
Yes, doctor.
Okay, Miss Hani, there are some lifestyle modification which I will tell you. Which I want to tell you that please, first of all, I would like you to please discuss with me, have another session about stop smoking. It is it will be have a great impact on your life because smoking, as it has been seen that many people who quit smoking, they have a very good effect on the cluster headache because looks like that it is associated with cluster headache. Is it okay for you?
Sure, doctor.
Moreover, I will tell you, please, if you can reduce your alcohol to a minimum level, whatever you can, and gradually reduce, and then quit alcohol as well. Can you do it?
Doctor, I'll quit smoking, but not alcohol.
Okay, we will. I will discuss in detail later. Okay, and maintain your sleep routine. And I will give you a medicine, and I want you to refer to your specialist, brain specialist, which will give you oxygen. Will tell you about the use of oxygen, 100% oxygen, 12 to 15 liter during your attack. And they will also give you a medicine which is called sumatriptan subcutaneous 6 milligram injection, subcutaneous injection during attack. And if it will not respond after 1 hour, they can give another injection, and they will advise you to keep oxygen cylinder at home in case of emergency. So if you will not respond to, you can
Time up,
go
Dr. Maida.
Maida.
Yeah, Dr. Maida. So, Dr. Maida, what was the examination? Not done?
Examination done, but everything was okay. I did back fundoscopy. I said I will do fundoscopy at the end of session. Then I checked temporomandibular joint. I ruled out temporal arteritis, trigeminal neuralgia, facial nerve palsy, and general physical examination.
So, what was the nerve, cranial nerves tested?
Seventh nerve,
Mm.
visual acuity,
Mm.
to check any oculomotor trochlear abducent nerve,
Mhm.
facial nerve palsy, and specifically I ruled out trigeminal neuralgia by sensation and temporomandibular joint abnormality.
That's great. So working diagnosis, you are having cluster headache, am I right?
Yes, cluster headache.
Yeah, that's wonderful. So first of all, when the patient come with any kind of pain, we have to go with a Socrates. Okay, patient
Mm.
sitting in front of you, SP sitting in front of you, have to say, can you tell me where is the pain? He or she will touch the area. So please use recognize the site, then onset, then character, then radiation, then timing, and now aggravating factor or relieving factors. Okay, so here we are doing a hybrid system, no, where the SP is also online, you are also online, examiner also online. So bit somehow modified. We are making Guzara kind of stuff, but we have to follow the Socrates because here examiner we they are for the pain specifically they wanted to see, they wanted to know about whether you are asking about the Socrates or not, because this is international criteria. So we have to follow this as this father. If you are not following and you ask about only site and character and move forward, they will consider as a poor data gathering. So red flags are there. There are many red flags will be there. So young patient, only we have to ask about sudden worse thunderclap headache or onset in the second, never seen before. Okay, reduce consciousness level, visual loss, halos around the vision, red eye pain, and headache triggered by the exertion, cough or Valsalva maneuver. Age if more than 50. A patient come with new headache or scalp tenderness, jaw claudication, visual symptom. These are the red flags. Okay, here this patient we are not going to touch. We are going to send this patient for referral. Okay, morning headaches, vomiting sensation. Now, patient having some sort of HIV, cancer, immunosuppression, pregnancy, or postpartum. These are the red flag. Okay, here these patients also this kind of patient also we are not going to deal with this patient. Okay, so when to refer, that is the important part over here. Otherwise, you recognize the patient classical pattern of cluster headache. Second thing, you screen for it. Third thing, you give in high flow oxygen and other you are talking about, and you have to understand. Okay, but verapamil is usually, if like say I'm saying that I'm going to give you verapamil, it is for specialist drug. So we have to refer this patient. And for that one, we need, ECG monitoring also, and addressing the impact on the life and mental health, and provide robust safety netting, and avoid opioids. We should not say, I will be giving you opioids, and be cautious with recurrent presentations. Okay, so this is from my side.
Dr. Imran, when we can say about verapamil, because this patient came first time to doctor, so right now we will only say that a specialist will give you oxygen during attack and sumatriptan. Should we mention verapamil here in this
No,
scenario or
doctor.
not?
No, doctor. This is I just giving you, because here what the discussion of the case and discussion of these things, to give you a little bit broader aspect and broader idea, rather than only focusing on the cluster headache. So, for example, now I'm giving you again example. Previously, MRCGP OSCE was a bit straightforward. They were asking about first line. Now they move forward little bit more further. They are asking
Hmm.
for second line and third line.
Hmm.
Okay, just giving example in August exam, case was varicose vein.
Hmm.
Patient, doctor given a treatment. The doctor mentioned about what you this Stockins. Patient suddenly said, "Doctor, I am immediately using. Tell me something different now."
Hmm. Hmm. Hmm.
Okay, now doctor said, "Okay, I'm going to send you for surgery." Doctor, why you doing? What you doing about that one surgery?
Hmm.
They will cut my leg. So
Hmm.
means a doctor used some word which was not, appropriate to talk on that scenario. So patient was
Hmm.
a little bit, more aggressive. So here
Hmm.
we should know first, second, and third line also now, because now more competitive exams are there, and they are more polished and they are more innovative actually now. So they are
Hmm.
coming with something new. Okay, so
Hmm.
that's the reason I'm always coming when I'm giving this kind of thing, that we have to go for it. So sometimes they will go for they come for preventive or prophylactic treatment also. They will ask about preventive treatment. Scenario can come about short-term preventive during the cluster about. Okay.
Hmm.
Okay, so they wanted to know how safe you are, doctor. So you are giving verapamil without saying ECG and without sending to the specialist.
Hmm.
No, here you should say
Hmm.
that there is a treatment for prevention. For that one, we need
Hmm.
to go further for the specialist management, and they will what they will do. They will be giving this treatment, and they will do the ECG before doing that one. This is the agenda
Hmm.
of that. That will be the agenda of that scenario. If in case if you're getting.
Yes.
Yes, okay. And lifestyle and trigger advice. Sometimes patient will come with that one. Okay, patient is smoking, taking alcohol.
Hmm.
Okay, so we have
Yes.
to stop that one.
And
Okay.
in this scenario, a patient said that she had used to have these episodes during weekends.
Yeah,
No, sorry,
Weekdays.
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 And she's okay on weekends.
Yeah.
So what to do for that?
Because she's not taking alcohol on weekends.
Yes, doctor. And doctor, there is a unique
Okay.
scenario. I will tell you. It might not come, but I'm just going to give you idea. Patient is having headache. Patient is taking GTN spray.
Hmm.
Okay, so we have to see. In this case, I'm going to refer this patient to the specialist for alternative. You
Patient is
got my
having
point.
headache and taking
Ha-
GTN spray for what?
Yes, yes, and patient taking strong so GTN spray for maybe from for his heart condition, angina.
Okay.
Right.
Okay, this
Then
is a strong
GTN,
yeah, I see it is a strong
vasodilatation.
vasodilator. Okay,
Yes.
so here it is essential for the patient for lifeline. Okay, because life saving drug, but patient is having cluster headache.
Mm.
What to do?
Yes. Yes.
Okay, so for that patient, we have to send patient to the specialist for drug reconsideration and drug dosage, whatever so
Oh,
on.
okay.
Okay,
Mm.
and smoking cessation is advice as always. So, doctor, we are already going to be 3 hours. We are tired already. Dr. Azwa is there and Dr. Aksa. And there is one doctor I will be taking. We will take these doctors on Sunday, inshallah, afternoon. Is it okay for you guys?
Only Dr. Aksa is remaining for today. She confirmed.
Dr. Aksa,
Um,
okay. Yeah,
yeah,
Dr.
only four
Azwa.
doctors confirmed.
Okay, Dr. Aksa also not there, I think so. So, Dr. Maida, how many
Okay.
cases you have done?
2.
Two. Okay, we will do last case for her.
Sure.
Okay. And just one point, Dr. Maida, sometimes you will get difficult patient. Like I said straight away, I will not quit alcohol. So
Yeah.
alcohol is the like triggering
Main.
factor. You have to address it
Yes.
importantly. Like this is since you are taking it on weekdays, and she was telling you history like whenever I'm coming back home after meeting my friends, okay, so she is drinking outside, and every time at night she is getting. So this is most probably triggering factor alcohol. You will tell her it's very important since this is the only trigger factor in your case. And I saw you were taking history, but kind of haphazard. First, you ask what happens to you, at how frequently, and how long it stays. Okay, then you can go on pain scale, then associated factors, then go on differentials and red flags. Okay, so your next case.
Okay.
24-year-old male, Mr. Hassan, came to discuss his problem with you. Please proceed with history examination and management plan.
What is the case number,
24.
doctor?
Yes.
Sorry, case number 5.
Okay.
Okay. Hi, good morning, Mr. SN. My name is Dr. Maida. How can I help you today?
Doctor, actually, I went for this blood test and now they came positive for hepatitis B.
Okay. Mr. Ahmad, may I know something more about it?
Yes, doctor, even though I feel fine and I'm generally well in my health, I don't know why this is positive and I'm really scared now.
Okay, Mr. Ahmad.
It's just on routine screening.
I can understand your worries. It's natural. But is it okay if I will ask few more questions from you?
Sure, doctor.
Okay, Mr. Ahmad. May I know that you did this test for screening purpose only, or you have some complaint?
Doctor, it was in our a job screening, routine screening, so that's why I went through
Oh,
it.
okay, okay. And Mr. Ahmad, so this is the only test done, or any other tests were also done?
All blood tests done, everything was fine, but this was positive.
Okay. Mr. Ahmad, may I have a look of your test? Is it okay?
Okay. HBs antigen positive and E antigen also positive.
Okay. Mr. Ahmad, and hepatitis B surface antigen and antibodies are not done?
Yes, yes.
Antibodies is also
Overall
positive.
test is positive, or overall test is positive for active infection.
Active infection. Okay, Mr. Ahmed, as I can see your reports, please tell me that by any chance, do you have any abdominal pain?
No, doctor.
Okay. Any history of nausea?
Yes, doctor, I feel nausea
Nausea. How often you feel nausea?
daily in the morning mostly.
In the morning. And does this nausea gets better after taking food?
Yes, mostly when I'm taking these fluids and fruit
Hmm.
juices, it gets better.
Hmm. Okay. And Mr. Ahmed, may I know that any other symptoms like vomiting?
Mm, I had one time, but it
Hmm.
was fine after that. I was taking this
Hmm.
vomiting
Hmm.
controlling
Hmm.
pills.
Any heart burning sensation?
No, doctor.
Okay. And what about your bowel habits? Is it okay? Normal?
Yes, doctor.
Okay. And how about your urinary symptoms? Everything is okay, like passing urine, no pain, any pain while passing urine?
No, doctor. No pain.
Okay. Okay. Mr. Ahmed, did you ever notice what is the color of your stool?
Okay, it's normal.
Normal.
I just
Okay.
feel fatigued little bit.
Hmm. Okay. And do you feel this fatigue all the day or some specific days?
At the end of the day, I feel fatigued mostly.
Hmm. Do you feel any feeling of indigestion or like not able to digest food?
No, doctor, it's fine.
Any abdominal distension?
No, doctor.
Okay. Did you ever notice any swelling on your feet?
No, doctor.
Okay. And Mr. Ahmed, do you have any long-standing illness
No, doctor.
like any liver disease?
No, doctor.
Mr. Ahmed, by any chance you have any blood transfusion?
No, doctor.
Okay. By any chance, you have been sharing any come in contact with needle prick with someone?
No, doctor.
Okay. And may I know that, Mr. Ahmed, anyone in your family having same problem?
No, doctor.
Anyone in your family diagnosed with hepatitis?
My uncle was diagnosed with hepatitis and he was put on medication. Now he's doing fine.
Okay, good. Mr. Ahmed, may I know that if you have been ever hospitalized,
No, doctor.
any drug allergy?
No, doctor.
Okay, Mr. Ahmed, may I know that do you have you ever been smoking?
Yes, doctor. I take 3 to 4 cigarettes, not a lot in a day.
Okay, and how many years?
10 years.
10 years. Did you ever think about quitting smoking?
No, doctor.
Okay, may I give you a leaflet? You can have a read or about the smoking cessation techniques and about hazards of smoking, and we can have another session about it if you are interested in quitting smoking. I'm here to help you.
Sure,
Is it
doctor.
okay? Thank you,
Sure,
Mr. Ahmed.
doctor.
How about alcohol intake? Do you consume alcohol?
Yes, doctor. I take so much alcohol.
Oh, okay, Mr. Ahmed. May I know how much?
Like in every sitting, I take 3 to 4 glasses of beer.
Okay. What about any plans to quit alcohol?
No, doctor.
Okay, Mr. Ahmed, I will request you to please think about it because it is very important for your health. As you know, based upon your report, I will advise you to please think about quitting alcohol. You can gradually reduce amount of alcohol, and then ultimately you will able to quit it. Is it okay?
Sure, doctor.
At the end of session, we will talk more about it. Mr. Ahmed, any recreational drug?
No, doctor.
Okay, Mr. Ahmed, what about any drug allergy you have?
No, doctor.
Okay, Mr. Ahmed, may I know that are you married?
No, doctor.
Okay. And then to whom are you living with?
I'm living with my parents.
Okay. Mr. Ahmed, everything okay at home and job? Any stresses in life?
Yes, doctor, everything is fine.
Okay, good to know. And may I know about your dietary habits? Any specific diet you like?
I'm taking in general good diet, but sometimes I
Mm, mm,
take from outside also.
And may I know about your body height and weight?
25.
Okay. Mr. Ahmed, will you allow me to have a quick examination for you?
Sure, doctor.
Okay, thank you, Mr. Ahmed. I will sanitize my hand under complete privacy. I will do your general physical examination after taking your pulse, blood pressure, temperature, and I will check your. I will ask you to open your mouth, any mouth ulcers, and I will ask you to elevate your tongue for anything abnormal, any like or central cyanosis. I will check jaundice and anemia. I will check your skin for any pigmentation, any yellowness of skin. Then I will palpate your neck for lymph nodes and thyroid. Then when I will request you to expose your abdomen, I will do gentle inspect, and then I will do gentle palpation and then deep palpation for your liver and spleen specifically. If there will be any pain, please let me know during examination. I will check your liver and I will check the upper border. I will percuss upper border till the lower border. I will check your spleen and percuss the spleen as well. And any tenderness, I will check for any tenderness in abdomen. Then I will check for your lower limbs for any edema, and I will check your feet as well. So yes, that's it. So any
Yellow,
positive
yellow color, yellow color skin with scratch marks.
stretch marks? Okay, Mr. Ahmed. I forgot to ask you that you, as you already know that you have this test. So do you have any concern regarding this test?
Yes, doctor, just I don't know what my employer
Hmm.
will do with me. So
Sure.
I'm concerned if it's something dangerous.
Hmm. We will discuss about it. And how can I help you today?
Just give me any medication or
Sure,
anything that needs.
sure. And is it impacting your life badly?
Yes, doctor, I'm stressed these
Mm,
days since I got the results.
sure. Mr. Ahmed, as per your history, it's clear, and as per your reports, it looks like that you have been suffering from a condition which is called hepatitis B positive, and the report shows that it's an active infection right now. So I will give you some advices, some lifestyle modification, and some medication as well. So is it okay for you?
Sure, sure, doctor.
Okay, Mr. Ahmed, for medicine, I will send you to a liver specialist. They will do your test, which is called ultrasound abdomen also, and before starting a medication, which is called oral antiviral drugs, and they will do some more tests before starting this medication. Good news is that now interferon are not used, which was very long treatment. Oral antivirals, they can work good as equally good as that interferon. And I will give you some lifestyle modification, like please think about quitting smoking and alcohol, continue your good lifestyle, do some walk, take a lot of water,
Time
increase
up.
fiber intake. Okay.
Okay, Dr. Maida. Is Dr. Maida, right? Yes, Dr. Maida. That was a wonderful approach from your side and good attempt. Let me tell you, whenever patient come with a report, the agenda must be there. Ask eyes about of in first.
Yes.
What is your idea on this one, Mr. Khan? Okay, what is your concern? What do you expect and how much you want to know about it? These are the four parts are there which will make your life easier and more to the point. Okay. Yes, exactly. This is a we call it a focused, focused approach.
Mm.
In your primary care, you will be having many time risk assessment and screening. Sometime you might arise. Sometime it will come as the initial workup when abnormal LFTs and risk factors are found. Sometime patient might arise, might come with a vaccination and prevention concerns, and sometime they will be coming with long-term monitoring in shared care for the stable chronic hepatitis B cases. So now here few things are there. We call it epidemiology and risk factors. Okay, key risk factors to ask about. Okay, birth and long-term residence in the high prevalence regions, like say in third world countries, household or sexual contact with hepatitis B positive individuals, multiple sexual partners, men with men, because it's very common now, and they are asking in the exam, doctor, and people who inject drug, needle sharing, and healthcare and other occupational exposure, like say working as a barber shop or a spa or somewhere they are using sharp items, hemodialysis, and recipients of blood products, pre-screening era. I mean, it was in pre-screening era. Okay, now they are screening. It is not okay. And children of mother with hepatitis B, they might come with the concerns of that one. Okay, clinical presentation, they will be coming with reports. Oftenly, asymptomatic patient will come. Okay, sometimes patient will come with right upper quadrant pain, viral prodrome like say malaise, fatigue, anorexia, nausea, myalgia, low-grade fever or jaundice, whatever so on, dark urine, pale stool, pruritus, whatever so on. Red flags are there, marked jaundice, bruising, confusion, drowsiness, and personality changes will be there, and GI upset like say GI bleeding and ascites. Chronic doctor, it will be difficult. We will be getting non-specific fatigue, malaise, and features of chronic liver disease based on case to case, like say ascites, spider nevi, and hepatosplenomegaly and encephalopathy. But in MRCGP scenarios, doctor, mostly they are picking up in a chronic cases specifically. Patient will come with doctor like say increased raised LFT, okay, and antenatal screening, okay, and occupational screening and immigration medicals. Like say doctor, I was like say I went for my checkup because I'm traveling to other country for my professional reasons, so it become a positive. Okay. And investigation in primary care, if like say you're getting new case, doctor, so you can go for LFTs, hepatitis B virus serology, like say, and you can go for hepatitis A and C, HIV serology. Okay, if you like say you're getting new case in the female, do the pregnancy test in child bearing age. Okay, if it is relevant, like say 3 week or 3 week plus, she's sexually active, do the pregnancy test. Okay, if you're not doing, it will be considered incomplete. And abdominal ultrasound if it is indicated. So if how you're going to say interpret common serology, how you're going to say, doctor, if you're susceptible, if you're thinking about susceptible, if you're thinking that immune from the vaccination, past resolved infection, or chronic infection. Okay, so this is based on report to report. Okay, so you
Yes.
guys know better than better. If like say still you want something, then we can share with you guys. Management doctor, acute hepatitis. Okay, mostly immunocompromised adults. Okay, clear with viral virus spontaneously. Okay, and management is mainly supportive with urgent hospital referral if there is signs of acute liver failure or severe disease. Okay, so and contact tracing is always important, and vaccination of non-immune close contacts. That will be the agenda. And doctor for the chronic, usually managed by hepatology or infectious diseases department. Okay, and vaccination, we have to go with the post exposure and vaccination. Okay, and after that, primary care consultation that I will be sharing with you guys because I'm running short of time. And that's it from my side, doctor.
Okay, just one
So,
point
yes,
I
doctor.
want to add regarding fibroscan. We need to
Yes,
mention
doctor.
it in every hepatitis or liver cases, mostly that is leading to the cirrhosis, because this is one of the leading causes of cirrhosis. And the guidelines are a bit changed. The indication of treatment for the hepatitis B virus is firstly we will check the HPV DNA. If it's equal to more than 2000, And with the elevated ALTs, then we will start the medication. First line is tenofovir, and then its alternatives entacavir. Okay, and every 3 to 6 months we have to monitor HBV DNA along with ALT. Okay, high risk and we need to mention in this case. Otherwise, fine.
Okay, doctors, thank you very much for joining such a long session, and it was such
Thank you.
encouraging for us to see. And see you guys on Saturday. Thank you very much, doctors.
Thank you.
Thank you, doctor.
Thank